has been conducting many more workshops in India as well. Sir is also a co-author for several books that help postgraduate students for their examinations, and he is also an editor for textbook on periodicity. Sir is a well-versed academician as well, and he has 24 publications in indexed national and international journals. He has taken editorial review for Journal of Clinical and Diagnostic Research since 2024 till date. We all acknowledge your efforts for being here, sir, and thank you for your presence. We all expect to have an informative session on lasers today. So on that note, I welcome you onto stage. May we please have you on stage. Thank you.
Thank you, ma'am. Flowers are the bounty of nature which express humility and tenderness of human emotions. They reflect both warmth and welcome. Now I request Dr. Lakshmi Tejaswini sir to accept a bouquet from Principal sir as an expression of our affection and reverence. Light symbolizes knowledge and divinity. It not only dispels darkness but also illuminates our souls. I request our esteemed Chief Guest Dr. Lakshmi Tejaswini sir, Principal sir and Head of the Department to kindle the auspicious lamp to embark on today's proceedings. I request everyone to please stand for a prayer song by Priya. Finally.
महागणपतिं मनसा स्मरामि महागणपतिं मनसा स्मरामि महागणपतिं वसिष्ठवामदेवादिवन्दित महागणपतिं महादेवसुतं गुरुगुहनुतं महादेवसुतं गुरुगुहनुतं मारकोटि प्रकाशं शान्तं महाकाव्यनाटकदिप्रियं मूषिकवाहनमोदकप्रियम् महागणपतिं मनसा स्मरामि महागणपतिं. Thank you.
Thank you, Priya. Thank you all. Please take your seats. Unfortunately, our director, Ms. Raja Shamla ma'am, couldn't join us in person, but ma'am have sent a video message for us. Let's watch it.
Sir, today our honorable guest, Mr. Lakshmi Tejaswini, dear faculties, dear students, and dear interns. Welcome to the King's Amalapuram. And today's periodontist department is celebrating their CDE program, and I welcome all of them to participate in that. And Lakshmi Tejaswini is expert in laser technology, and he is very much expert in doing that laser with less bleeding and less painful technology. He is very expert in that. Today, please students do participate in that, and in the morning session there is classes is there, and in the afternoon session there is a hands-on workshop is there, and please do participate and have a nice session today. Have a good day. Wish you all success.
Wish you could have been there, but this video message is a wonderful way to feel your presence, ma'am. Thank you. Now, I take privilege to request our Honorable Chief Guest, sir, to start with lecture.
better. I don't feel like this. Okay. Karthik is calling. 1 second. Just speak to him once. నార్మల్ చార్జర్ చార్జర్ నార్మల్ చార్జర్ ప్లగ్ పాయింట్ Is it audible right till the last? Sorry for the delay. That's not my fault because of the train. So the train was delayed by 3.5 hours. So it's not in my hands. So welcome and thank you. First I should thank Dr. Shivkumar sir and Dr. Karthik and Dr. Meghana because they have been in contact with me from past 1 month and they are continuously working for this CD program. So thank you very much. So this is the college where I work currently. That is in Malaysia, where it is the name of the university is MASA. MASA means Malaysian Allied Health Sciences Academy. So they can't call with so much big name, so they are calling with short name, MASA. Right? So that's about me in simple. So if anybody wants to contact in future regarding anything on lasers, you can contact to my number or to my mail ID. So this is the place where I think, can I switch off one light so that it will be easy for them to cleanly visualize? Is it okay? One light. Yeah, fine. Sincere request not to sleep because as I switched off the light, I request not to sleep. 90% you will not get the sleep, but I will try my level best not to have any sleep, okay? So this is the place where I work and these are some of the pictures of our university and he is our dean. So this is the beauty of our place where I am living right now. So and all these are taken from my camera, not from the net. All these are from my phone or from my camera, not from the net. 90% of the pictures, 95% are from my camera only, not from the net or from any other place, including the cases which I am showing right now. Except for 2 cases, remaining almost 90% by myself, including these pics. So coming to the lasers, today's topic, a boon to enhance clinical practice. I request those in the last, so please be attentive because the first 20 minutes to 30 minutes of my lecture is very, very important for your hands-on. If you are not able to understand I don't have any hesitation. You can ask n number of times. No problem. But if you are not able to understand this half an hour, it will be like a Greek in Latin for the next whole day. Okay. Just scan this QR code. That's the reason it took some time for me. Anyone can scan this QR code, no issues. You can scan this QR code. And second thing, is laser visible or invisible? My simple and straight question. Scan this QR code. Don't take photograph. Scan the QR code. Is the laser visible or invisible? This is open. See, I don't like to simply sit and stay because I know the student mentality, those who sit there. So definitely that's the reason I like more of interactive session rather than one way. Because if it is one way, most of you will sleep. It's a two way, then it will be active. Because the laser physics is bit tough, and if you understand, it is interesting. So did you scan the QR code? Fine. Okay. Why I kept this QR code system? Because 90% if I say to ask any question, they feel shy to answer. So this QR code means anybody can have phone right now and anybody can scan and you can say the answer and it will be displayed there. So the question is visible right now, I think. So the same question which I asked, I think the screen is not getting duplicated. Why? Yeah. So 100% saying yes. Is the laser visible? The same question which I asked. You can scan the QR code and you can say the answer in that. Only 92%, 8% now saying no. Okay. Oh, no is increasing. Fine. Okay. 13% right. 21. Oh, 40. Fine, fine. So still, okay. You have some more time. Why I specifically kept this QR code system? Because if I asked you to raise your hands, they'll feel shy to answer. So this means anybody can answer and no name will be displayed. You can happily say whatever the answer you know. There is no name. Anybody can say whatever the answer you can in the QR code. No issues. 62% says yes, 38, no, 60, 40. No, still it is. Some people are still in dilemma. Okay. The question is very simple. Is the laser visible or invisible? So everybody can see the laser light, right? Is the laser visible or invisible? No. Still doubt. Okay, fine. We'll see the answer. Just give me a couple of minutes. And okay, fine. See this question and answer once again this. So a patient in the third trimester or first trimester of pregnancy came to the clinic for dental treatment. Is the laser safe to use? I am extending the question by mistake. Okay. You say first this answer, then we'll go to the next one. I just want to know what basic, because your interns are there, year 4, I don't know how many combination PGs are there. So first I want to know the knowledge of laser, basic laser. I am not saying about any specific laser, just laser, whether it is erbium YAG or diode or ND-YAG or what, or carbon dioxide or any laser. Just I am asking laser. Still in doubt. What, 54? Yes. 50-50. Fantastic. So you are also in dilemma. Fine. No. Now raising is not safe. No. Okay. 40, 53. Okay. Majority are saying no. Okay. 52. Still in dilemma. Fine. I'll give one more extension of this question. By mistake, when you are doing the laser, you are in a phone and the laser has fired on her stomach for 1 minute. 1 minute, patient didn't notice, you also didn't notice, you are firing the laser on her stomach like this. In her first trimester or third trimester. So nothing happened that time. After the delivery, patient baby had a genetic anomaly. Patient complained and sued on the doctor saying that this is because of the mishap happened during the dental treatment. You understood my question? You are doing the laser procedure, you fired not intentionally, unintentionally you fired the laser on the patient's stomach. Patient is first trimester or third trimester. At that time, a small cut or wound happened and it healed after 1 month or something like that. The patient has delivered a baby and the baby is having genetic anomaly. And patient sued on the doctor saying that this is because of the laser. What you will say? What is the full form of laser? Light amplified stimulation emission of radiation. So it is one type of radiation. So patient sued. Because why I am saying this question, because recently I think many of you know in Hyderabad in one clinic one patient expired on the dental chair itself, and the whole mishap was happening, say, complaining about the doctor. Of course, I don't want to go in detail about what happened in that case and which hospital. I think most of you will be knowing about that incident. If such incident happens in your clinic when you are doing laser, what you should say? That's the reason I kept this question. Suppose if the patient has still, no, you're saying no. Okay, 73% finally said no. Okay, fine. We'll see the answers in couple of slides. Keep thinking about it. Nowadays, most of the patients wants these 5. Your practice to be successful means you should have this. 1, aesthetics. You should be very good. Minimally invasive. Patient requires as least as possible invasion. Third one, less pain. Most of the doctors, not only dentists or any other, are afraid of injection because of pain. So if the pain is not there, patient is happy. And everybody wants fast treatment, very fast. Like a T20 match, no need of test match also. They want in very fast, within 2-3 hours to finish the whole procedure. So, and the last, less appointments. Patient will be in the chair itself and asking, can you finish in 1 or 2 appointments? I want to go where, some other place. So these 5 are the most common requisites for a patient right now if you are practicing dentistry. Right? You agree or not? Yeah. So that is the reason lasers will solve almost 70 to 80% of this requirements, because minimal tissue displacement, and the main advantage of laser is less bleeding tendency. You will not see any bleeding. If you see scalpel, I think most of you have done your extraction in your undergraduation, right? You see how much of bleeding you get. If you use laser, we will see how the extraction happens in laser also. And stable postoperative margins. This, if any postgraduate is doing implants, they will know once you want to open the cover screw, you see how much bleeding it will happen when you do with a scalpel or when you do with a burr. Whereas if you do with laser, then and there you can fix the abutment. No need of any bleeding tendency and less postoperative collateral damage. The subjacent tissues will not be damaged. And patient can see the result immediately. This is the main advantage of laser. I will show the photographs how the patient can appreciate the treatment what you have done, and less postoperative pain and swelling. This is the most advantageous. If you do extraction, third molar, you see this much swelling, right? If you do with laser, 60% of reduction in patient postoperative swelling and pain. I think everybody knows this, but I just kept this slide to have a proper idea about normal laser and the normal light. This is the basic difference. Laser light is single wavelength, one color, any one color because of its monochromacity, single color. Unidirectional, one direction, you can see the directions, right? Next, coherent, they form in a same pattern of wavelength and specific boundary. So these are the four advantages of laser when compared to normal light. Okay, this, what is the difference between, I think, how many of you used it? I saw the laser first of all, laser unit. Did anybody see the laser unit? Right. Laser unit will have, you generally if you ask what laser you have means how many watts. Whether 4 watt laser or 5 watt laser or 7 watt laser or 9 watt laser. Right. So what is the difference between power and energy? Anybody can say what's the difference between power, energy? What is power? What is energy? Anybody? No issues. No specific, and this is not a viva or anything like that. You can happily say whether it is right or wrong, no issues. What is the difference between power and energy? Which is constant? Energy is constant or power is constant? Energy is constant. Then what is the difference between energy and power? Simple. Okay, if here two girls are there, if I ask the first girl to take this pointer and keep in the other room, she took 2 minutes. The other girl, the beside girl, took 5 minutes. Who is having more power? First girl. So what you did here? You are comparing. What are you comparing? Time. Yes. So suppose if we think this pointer as energy, this is constant. The time that is required to transfer this energy from one person to other place or one place to other place is called power. Because that's unintentionally you have done it. The first person had done in 2 minutes is having more power. Means she transferred this from one place to other place in short time. That is power. Understood? Understood my logic or not? See, power is the amount of energy done, amount of energy transferred in a duration or particular time is called power. So the ability to do the work in simple is called power. And the ability to work is called energy, and it is measured in joules. The amount of energy per particular area is called as fluence. Power is the work performed in particular time. That's what I said right now. The work performed in particular time is called as power. And power density is the amount of power which you can concentrate in particular area. That is called as power density. These are the few terminology which I am specifically saying because every time we will be saying power, power density, energy, joules like this. So that's the reason this is very important.
Sir, we actually plan to live stream the lecture today, sir. So can you just give us 5 minutes while we install the software?
Okay, make it. So power is equal to, you can do it, you can do it. Yeah. Okay. The question, meantime I will say the answer for the first two questions. First one, laser is visible or not? Everybody said yes. Answer is no. Laser is invisible. Then everybody can ask, I can see no sir. Correct? You are not seeing the beam. You are seeing when it touches an object. You can see? You are not seeing the beam, right? You are seeing only the point where it is touching the surface. So you are making the laser visible because of certain means. If it is in a visible spectrum, then it is called visible. Laser is not in visible spectrum. 400 to 700 is the visible spectrum, right? Violet, indigo, you can have the colors. In that, laser is not there. So it is invisible, but you are making it visible. That's the reason if you see any laser show, you can see the laser, but you will see a smoke also. Why? Because if you want to see the laser, you should make it visible by means of other sources like smoke or something like that, so that if it comes and touches with that object, then only it will be visible. Understood? Second question, laser is safe or not? 100% safe, because it will not fall under the spectrum. Once again the same answer for that. Laser falls under mid infrared zone or infrared zone or far infrared zone. It is not an ionizing radiation. If you remember your electromagnetic spectrum, which when you did in physics long back, it will not fall under ionizing radiation. It is a mid infrared zone, and you can 100% argue that the anomaly is not because of my laser. It is because of something, your coincidence or bad luck happened to that baby, but it is not because of your laser. You can 100% use in first trimester or third trimester, including second trimester, no issues. But only one thing, when the pregnant lady is there, see the time duration. Don't do the procedure for prolonged period of time, because the patient will feel discomfort because of the posture, not because of the laser. Clear? Got it? Right. And everybody said light amplified stimulation emission of radiation, right? Laser means. What is meant by stimulated emission? Stimulated, you only said, right? Laser means light amplified stimulated emission of radiation, correct? Radiation means, you know, everybody right now has said. So light, everybody know what is the light. What is meant by amplified stimulated emission? What is amplifying what? First, what is stimulated emission means? Every time you will be knowing stimulated emission, stimulated emission. What is stimulated emission? First of all, what is spontaneous emission? Then we see stimulated emission later. What is spontaneous emission? Then you understand what is stimulated emission. Clear? What is spontaneous emission means? Don't by heart the subject. Everybody knows from almost from BDS first year or second year, they will be knowing what is meant by laser full form. Nobody knows what is meant by stimulated emission or spontaneous emission. Anybody can say, no issues. Anybody can say, I will give a prize also. I am saying 100%, and there will be a prize if you say the answer also. I am not joking. Anybody can say, no issues. అయిందమ్మా పెట్టచ్చా? ఓకేనా? పర్లేదు, ఓకే పెట్టేసేయండి. దీనికి రావట్లేదు. ఏం రావట్లేదా? అయిపోయిందమ్మా. ఒక్క నిమిషం. అదే బట్ డూప్లికేట్ అవ్వట్లేదు. ఆపేసి మా స్టక్ అవుతుంది. ఏం చేస్తారమ్మా, హ్యాంగ్ అయిపోయింది. Yeah, fine. Still nobody could get the answer for spontaneous emission and stimulated emission, right? Okay, anyway, see why I am saying so specifically about this power, energy, watt, all these things, because if anybody is using laser, suppose if you want to cut any tissue, most commonly used for gingivectomy or operculectomy or crown lengthening, whatever the procedure, if the tissue is not getting desiccated or ablated, or if you are not able to make the cut, we generally call ablation, not cut actually. So when it is not able to ablate it, the first thing the student or the practitioner will do is raise the power, right? If you are not able to cut the tissue, what you will do immediately, from 2 watts you will jump to 2.5, then 3, then 4, then 5, like this. But never ever raise the power immediately, because instead of raising the power, reduce your hand speed, automatically it will cut. This is the reason I showed power is equal to energy by time. So energy is equal to power into time. So instead of raising the power, you reduce the time automatically. Here, instead of, if you raise the power, you are raising the energy. If you raise the energy, tissue will be burnt. I think most of you have seen the Krish movie, right? In Krish 3, I think he takes lot of energy, so body will blast out. What is happening there? It is not able to take so much of energy. In simple, I think in your childhood, you'll be playing with a candle, right? You place the candle and pass the hand like this. If you pass, you will not get damage to your fingers. But if you pass slowly, your hand will be burnt out. So unnoticingly what you are doing is, you are passing the hand very fast, so that your hand is not having any damage. So why? Because before it gets damaged, it is cooling down, because you are moving very fast, right? So if you move the hand slowly, you are giving more energy to the finger. Got it? Because more time it is in contact with the candle, so your hand will be burnt out. Clear? So in the same way, if you raise the energy, automatically you will burn the tissue. This is the best example. If you raise the energy, means if you place on candle for a long time, automatically your hand will be burnt out. Got it? So instead of raising the power, you raise the time, means you increase the time, automatically tissue will be ablated. Means you move your hand slowly when compared to the previous one, automatically tissue will be ablated. This is what the first step I say. Never ever raise the power, because if you raise the power, tissue will be burnt out. You will get black charring, black tissue, more blackness, less healing. And never ever complain the laser saying that this is not cutting. It is a tool. You should know how to use it. You can't blame the laser. You should know how to use it. You can't say that it is not cutting, means it doesn't know anything. You should know how to do it, right? What happened? Yeah. So this is the best example. You see, both the lines made on the tissue are with same watt. Same watt. But one is moved faster, one is moved slower. Hand movement. You see, this is moved slowly, so you can see more of blackness. More tissue burnt out. This is moved bit faster. Hand movement. But same watt, but difference in hand speed. That's what I say. If you move your hand a bit slowly or fastly, you can cut more easily rather than raising the power. If you raise the power, automatically the tissue will be burnt out. Don't do that. Like how you are increasing in the candle experiment, right? This is the answer for your first question which I said. You can see here, start from the spectrum, from here to here, see the wavelength. The first time wavelength is very less, so frequency is more. I think in your childhood I learned this frequency and wavelength. The length of the wave is increasing, means the frequency will be decreased. So here frequency is less, here frequency is, here frequency is more, here frequency is less. So when you move from this to this part is visible light. Your laser falls here and infrared. So this is the ionizing radiation, ultraviolet rays, X-rays, gamma rays. Laser will not cause any ionizing radiation. It is 110% safe. First thing. Second thing, this has more energy, right? More frequency. So that's the reason ultraviolet rays and X-rays penetrate very fast. This has less energy. That's the reason radio waves you will not. That's the reason every day you are listening radio. Nothing is happening to you, right? Otherwise everybody is in hospital only. Most of the car is having FM, right? So 90% you will be listening in the car. So if it is causing any radiation means all will be in hospital only. So this side you will not get any radiation effect because less energy. This side more energy. Got it? More frequency, more energy, less wavelength. Clear? Right. So this is the spectrum what I am saying till now. This is the visible spectrum. All the lasers, I am saying all the lasers will fall under infrared zone, near infrared, mid infrared, far infrared. Clear? If you take carbon dioxide laser, 9300 nanometers length, wavelength. Got it? More wavelength means less frequency. Correct. Less frequency means more wavelength or less penetration power. Because no energy, right? Wavelength is this much long means it can't penetrate that much. Whereas if you take diode laser, this one, what we are using today in our workshop, the diode laser, that is 980 nanometers. Nowadays in diode they have three wavelengths, 980, 810, 450. The laser which you are going to see today will have three wavelengths, 450, 810, 980. Why? 810 is infrared zone, 450 is more towards visible, 980 is more towards mid infrared. Three types of wavelengths are there right now. We will say what is the reason why they are giving these 3-4 wavelengths. Nowadays in confident companies coming with 4 wavelengths. Same diode only. We will see why. Yeah. I asked it spontaneous emission and stimulated emission. What is spontaneous emission? See, this is also the basic physics. Why I am saying so slowly, because this is the point where nobody understands and simply keeps pressing the laser unit buttons. They don't know what to do first of all. Spontaneous emission means, I think in your Einstein's model previously in your childhood time or whenever starting your physics in your intermediate, whenever I think every atom has electrons and center there will be nucleus, right? When you give energy, the electron will move from ground state to excited state, but in excited state it is unstable, so it tries to come back to ground state by giving energy out, right? This is spontaneous emission, because when you give the energy, immediately it goes to excited state, come back to ground state by giving certain energy. This is called as spontaneous emission. Whereas if you give an atom in the electron which is in excited state, you pass one more energy of same amount which is taken in the ground state. It produces two energy photons of same wavelength. That is called as stimulated emission. In simple, see, when the spontaneous emission means when it is coming from excited state to ground state, it produces one photon. This is normal. Whereas when it is in excited state, if you make it fight, or if you have a bombard with one more photon of same wavelength when it is in ground state, then that will produces two photons of same wavelength. This is called as stimulated emission, where you are stimulating the electron in the excited state with same amount of energy which is it has taken previously. It produces two photons of same energy. This is called as stimulated emission. Why this is very important? Because when you do like this, one photon will stimulate, produces two photons will stimulate four photons. Like this, all the atoms that are present in the laser beam or in the laser medium will be stimulated to produce the laser out. This is because all the photons have same energy, same wavelength. That's the reason laser has same energy and same wavelength, because of its stimulated emission of radiation. For this, one side you have a perfect beam, or one side you have a correct mirror, the other side you have a partial reflecting mirror, whereas so that the whole articles or the atoms will be reflecting each other and a laser beam is produced out. This is the specialty. See, you can see in this, once in unexcited state, it becomes excited. Automatically multiple photons will be activated by them and they will produce the laser beam out. This is stimulated emission. I think many people know what are different types of lasers. I don't want to go in detail about What are solid lasers? What are excimer lasers? Gas lasers? There are many lasers broadly classified into two: ablation, non-ablation. Ablation means which can be used for cutting. Non-ablation means just for photodynamic therapy, photobiomodulation, or you can use for composite curing. Many of these are used for non-ablation. Ablation means for root canal disinfection, for extractions, for surgery. All these are for ablation lasers. Whenever a laser touches a tissue, it has four properties: absorption, transmission, reflection, and scattering. Which is useful for us, which is dangerous for us? Which is the property which is required for us, which is not required for us? Yeah. Which property of the list? Backslide. Which property of the laser is useful for us? Absorption. I think you know all the properties, right? Absorption means laser will be taken. Transmission means laser will be passed out. Reflection means body will reflect back. Scatter means it will distribute. Right? So which is useful for us? Absorption, transmission. Which is dangerous for us? Scattering. So reflection, no. Reflection is odd man out. There are four properties, right? When you touch a body with a light, not only light, laser light, any light, some part will be taken, some part will be transmitted, some part will be scattered, some part will be reflected. Right? Correct. I will ask one more question. Why the sky is blue? Reflection or scatter or absorption or transmission? Sometimes in the morning it will be red. Sometimes it will be blue. If it is cloudy, it will be black also. I mean, not black, grey. All these colors are because of. Why your car is white in color or black in color? Absorption or reflection or scatter? These properties of light are not unique for laser only. Anything light only, right? This is also light, that is also light. Anyway, the answers for this question, first one, which is useful is absorption. Absorption is required first of all by the body to have any action. Remaining three are useless. All three are useless except for absorption, because reflection, that is the reason you are wearing goggles, because if it reflects into your eyes will be damaged, and bad luck, our eyes can't detect laser. If you place your laser beam like this for 1 minute, you will become blind, no problem, happily. If you want, you can try, no issues. But see, because our eye can't detect the laser light, it is only detecting the visible light. That's the reason if you have high light, you will close your eyes because you are detecting that light, whereas laser light is not able to detect by the eye. Absorption is required because it has effect. Reflection is dangerous of all because it will reflect to the body, eyes and skin, and it will be damaged. Second, scatter unnecessarily damages the adjacent tissues. Don't damage the adjacent tissue. You want the laser to act only at the site of action, not adjacent sites. Next, transmission. You should act on that particular object, not transmitting and acting in somewhere else. Transmitting means it will go through the body. But this property is used in one field of medicine. Can anybody say? This transmission not used in dentistry, but used in other field of medicine. You can see that ophthalmology, where most of you have done. Anybody done LASIK? Eye surgery with LASIK, where you have lens, where instead of, if they pass the laser light without damaging the cornea, they will straight away enter into the other parts of the body, other parts of the eye, without damaging the center beam, because it is transmitted and enters into the other part of the eye. There they use this property of transmission of laser light. That is the only area where laser is useful. Transmission, I am saying, other than absorption. Second thing, when the transmission is happening or when there is absorption happening, we will see this most of the times. Nd:YAG and diode are dangerous when compared to erbium YAG and carbon dioxide, because this Nd:YAG and diode damages retina, whereas carbon dioxide and erbium YAG damages cornea and lens. At least corneal replacement is there. Retina damage, God only, finished out. Blindness only, there is no other alternative. Why this happens, we will see. See, when it is scattering, you damage the adjacent tissues, which is dangerous. When you reflect, it will cause reflection damage to eyes and skin, so that is also dangerous. Only absorption is correct. Right? Fine. These are the different wavelengths of different lasers. Starting from Nd:YAG is 1064, diode is 810, 980, carbon dioxide 10600, erbium YAG 2780, erbium chromium, erbium is 2940. According to this, which has highest penetration? Highest penetration means least wavelength, which has shorter wavelength. Longer wavelength means less energy. I said already, frequency will be inversely proportional to wavelength. When the wavelength is long, frequency will be less. Frequency is less means energy is less. Energy is less means penetration is less. Understood? If you have more energy, you run faster. If you have less energy, you can't run faster, right? So you should absorb more means you should have more energy. So of which is having highest depth of penetration? 810 diode is having least wavelength. So it should have highest penetration. Correct? Right? Least penetration is? Which is having long wavelength? Carbon dioxide. So this should have least penetration. See the answer. Which is having highest penetration? The laser is not following the pattern at all. What I said right now. Here highest penetration is Nd:YAG is having. Then diode 810, then 980. Carbon dioxide is having least, erbium is having least of all. Clear? Why? Why this is happening? Why the laser light is not obeying the normal spectrum or wavelength, or what is happening to this? Because means there is one more factor which is governing this depth of penetration along with wavelength. Got it? Understood? What is that? Is this one, chromophore. Chromophore is, in simple, if my wife or my lover is sitting in front, I can't see the back girl, right? Got it? If my wife is sitting here, I can't look at the other girl, right? Because I should concentrate on her only. Attraction or repulsion, that's a different issue, but I should see her only. Got it? In the same way, the tissue likes that substance more means it will not see the other one. In simple, diode likes more of melanin and hemoglobin. So melanin is present in which part of the body? In skin, which part? At the basal layer of epithelium. And hemoglobin is present in connective tissue, right? In eye, retina is having blood vessels. Got it? So diode will go till its effect or attraction. Its attraction is hemoglobin. Wherever hemoglobin is there, it will go till there. Or in simple, my wife is sitting at the last, I will go till her. Simple. Because she is there, because my attraction is there. Wherever the attraction is there, or the tissue attraction is there, it will go till that place. If it is front, it will stop here. It will go last, it will go there. Simple logic. In the same way, laser's attraction is, diode attraction is melanin and hemoglobin. So hemoglobin is present, wherever hemoglobin is there, it will go till there. Or melanin, anyone. So both are present in connective tissue one is present in basal layer. In eye, it is present in retina. So it will go till retina and damage it. Damage means it will take till there because it will attraction is hemoglobin. In the same way, erbium mag likes water and hydroxyapatite crystals. Where is water present in the body? Where is the water present in the body? Every cell has water. Every cell, including the epithelium, also has water. So that is the reason the depth of penetration is erbium mag is very less, because its lover is in front. No need to go till the last. Because water is present in the first layer, it will stop there only. It will not go till the last. Got it? Whereas if diode is required, diode's attraction is towards basal layer or towards connective tissue. So it will go till the last. Got it? That is the specialty of laser. Remember this point. So the most important two lasers which we concentrate are diode and erbium mag. Erbium mag depth of penetration is very less because water, its attraction is water and hydroxyapatite crystals. That is the reason. Any endodontist here? Any endodontists? Most of the time, if we see carious tooth or a healthy tooth, laser penetrates more in which part of the tooth, either carious tooth or healthy tooth? The erbium mag laser penetrates more in healthy tooth or laser tooth, normal, the carious tooth. Why? Okay, fine, fantastic. Carious tooth has? What happens to caries? Caries means what is happening to the tooth? It causes destruction of the tooth enamel and forms what? Water. So if hydroxyapatite plus water, which is the favorite? I have two lovers or two attraction, which will go there first? Automatically carious tooth. So it is easy to remove the carious tooth rather than a healthy tooth, because two attractions are present in one place, so automatically more laser will be taken. This property is used in the diagnosis of tooth or carious tooth. That's a tool called diagnodent. Diagnodent is the one which identifies the carious tooth, right? So that property of this laser is used in the detection of caries, because carious tooth absorbs more laser when compared to healthy tooth. That's the reason if you want to prepare a carious tooth is easier than cutting a healthy tooth. More laser is absorbed here. Got it? Clear? The next and important one is continuous pulsed free running. If the laser is fired continuously, it is called continuous mode. If you make a shutter and make into pieces, that is called as gated pulsed mode. If the laser itself is coming in pulses, that is called as free running pulsed mode. Means there is no mechanical shutter. If the laser emission itself is pulses. Which is more dangerous, this or this? Correct. Continuous is more dangerous because there is, I said same, remember the candle experiment. If you keep on passing the candle because you are pulsing it, if you place like this, continuously your candle or the heat is getting touched to your hand, you will burn out. Always, if you want to cut or if you want to ablate a tissue, never ever use continuous mode. If you are using continuous mode means you are damaging your tissue. But it is used in two areas. Anybody can say? It is also good. I am not saying bad. That's the reason you should know when to use, where to use. Even our laser unit has continuous mode and pulsar mode. Where to use this continuous mode? Anybody can say? Where you don't. Anybody can say? Guess it at least. If you want to destroy a bacteria, you use pulsar or continuous? If you want to destroy a bacteria, you use pulsar or continuous? Yes, continuous, because there is no time. If you want to destroy the bacteria, fire the laser continuously and destroy it. No need to give a break, right? Bacteria want any cooling or what? You should destroy it with a continuous mode. Second thing, When you want to coagulate a tissue, clotting mechanism to activate, you should use continuously. When you want to desensitize, you have sensitivity, more pain, desensitize, use continuous, no problem. So some areas, especially when you are using ablation, if you want to cut the tissue, then always use in pulsed mode. This is very, very important, because if you use in a continuous mode, you will damage the tissue. This is what? Continuous, mechanical shutter, free running pulsed. Here laser is fired continuously, whereas here breaks are given, and this is in nanoseconds. Very fast, like your hand in your candle experiment, faster and faster. So I don't want to go much deep into this. This is called as duty cycle. What duty cycle means? When you are going in a pulsed mode, the duration between one pulse to other pulse is called as pulse period. This is what I am saying. Pulse period, one pulse to other pulse. The amount of the time the laser is fired is called duty cycle. In simple, the amount of the time the laser is fired is called as duty cycle. If it is 50%, duty cycle means only 50% of the time laser is fired. Remaining 50%, it is not firing the laser. This is what I am saying. 50%. If it is 75% duty cycle means 75% the laser is fired. 25% time it is off. If it is 25% duty cycle means only 25% time the laser is fired, remaining time it is off. This is what the duty cycle is. Why I am saying so specifically is, if you want to buy a laser, on what basis you buy the laser? If you want to buy the laser, suppose if I am having a laser company, I say my laser is good, or see there are in the market Denlays, iLays, Biolays, Alexion, Pion, Photon, Woodpecker. 9 types of lasers I use it till now. I used 9 companies. Every company says my laser is best. Nobody says mine is worst. On what basis you are going to buy the laser, first of all? If it is a, RVG, they say based upon the amount of cost is different. Everybody see the cost, forget the cost. Other than cost, if you want to see any other factor, that determines this. See, suppose you remember the same candle experiment. If you are moving your hand slowly, your hand will be burnt out. If you move one fast like this, nothing will happen to your hand. Same principle here only. If the duty cycle is 50%, means 50% of the time the laser is keep on firing. If it is only 10%, the remaining 90% there is no laser, means the body will cool down. Automatically you will have more thermal relaxation time, so that there will not have any damage to the body. This is what the basis of laser, where we see. I don't want to go much deep into duty cycle because time is running out. So when you want to have ablation, short pulse duration means very fast, like this. One shot you should fire the laser. Long pulse period means between 2 intervals you should have long gap, so that body will cool down. And less frequency, because don't want so many times you should fire the laser. Short duty cycle. 10% sufficient, don't go beyond. If you go more and more duty cycle, you will damage more and more tissue. There is much deep in this. I don't want to go too deep into this. 2 modes are used, contact and non-contact. The specialty of 450 nanometer diode is you can use in non-contact mode also. There's the one which I will show you in your practicals in your afternoon session. Normally diode laser can be used only in contact mode, whereas the 450 nanometer diode laser you can use in non-contact mode also. That is the specialty of it. Advantage of contact mode, you can feel the laser. Disadvantage, it will char the tissue. Non-contact mode, you can't feel the laser, but you will not char the tissue. You should know the depth of penetration. That is very, very important. So these are the 4 goals of laser. One is ablation, that is cutting, coagulation, stop or arrest bleeding, decontamination, biostimulation. Why I kept those things at the bottom? What is this? What is this? Eyes, right? This is brain. Why? The first two you can see. Ablation and coagulation you can see with your eyes. The remaining two, can you see decontamination or biostimulation? You can't see, but it will happen. You should believe it. That's the reason I kept that picture. So these are the four effects of laser. What is photothermal, photochemical, photomechanical and photoelectrical. First is photochemical. This part I am not touching because it is in advanced laser mode. If you want to learn, you should come to the workshop, big workshop. Because this is called as triple LT, low level laser therapy, or which is called as photobiomodulation. Okay. So that's mostly common as photobiomodulation, which we generally not discuss now because it's too lengthy for that to discuss right now. The next is photo disruption or photoacoustics. This is seen only in erbium YAG laser, where you can see it will produce a shock wave like this and it will cause disruption of the smear layer. This is called as photo disruption or photoacoustics, which will produce like a shock wave mechanism. It will cause disruption like this. It will remove the superficial smear layer, which is most commonly used in implantology, where to remove the smear layer. I ask most of the students, if you have a patient having peri-implantitis, generally you ask the patient to extract the implant and place a new implant. Why? Why can't you use the old implant? Same implant only, right? Why every time in a peri-implantitis situation you remove the implant, place a new implant? Why not the old implant? Because it is contaminated. If you can decontaminate it, you can use the same implant. That can be done with this phenomenon of photoacoustics. Next, photoelectrical, which is most commonly used for nerve regeneration actually, but we will not use in this. Generally we concentrate more on photochemical and photothermal. This is what I am saying, photothermal. Remember this, if you cross more than 100 degrees, you will get carbonization, and 60 degrees will get coagulation. So when you want to achieve a coagulation mechanism, you should cross 60 degrees. Means you should use continuous mode. Got it? That is what I am saying. This is whenever you want to activate the tip of laser, you use scissors or glass cutting pen or ceramic tile, where you are concentrating the laser energy or photothermal effect of the laser, so that you will have the desired effect. That is what is called as activation of the beam, where you take a carbon paper and try to pass like this and activate the tip. But for 450 nanometer, no need of activation. It is self-activated. That's the specialty of 450 nanometers, which we see in the afternoon. Okay. So whenever you are about to start a laser procedure, see this, it should have a concentrated circle like this. When you fire the laser, you should not like a comet. It should be like a circle. If it is like a comet, stop it, because the laser beam should be in a continuous mode. You should fall, not like in a comet. This is called laser tip activation, where we have a cork mechanism where we can fire the laser, activate the tip of the laser, and then start, so that it will focus that particular area without damaging the adjacent area. That is the specialty of laser beam. But this is for 980 and 18, not for 450. So different applications we start. First with endo. I said diagnosis of caries, mostly done with erbium YAG laser. Why not diode? Why diode is not used for diagnosis of caries? Its attraction is not there. Diode likes melanin and hemoglobin. Caries is made up of hydroxyapatite crystals and water. It will not like. So automatically you should cut only with erbium YAG laser, not with diode laser. Even cavity preparation, laser bleaching, this can be done with diode and erbium YAG, both. Whereas disinfection, this can be done with diode and erbium YAG, both. Because Bacterial contamination can be destroyed by any laser, diode or erbium YAG. But caution wise, I suggest you use more diode, because don't damage the adjacent tissues. If you use erbium YAG, you damage the adjacent tissues also. Diode means it has no affinity towards hydroxyapatite. It will concentrate only on the canal or the bacteria. Got it? Composite firing also mostly done with erbium YAG, not with diode. Second thing, ortho. Photobiomodulation or low level laser therapy, what we call as PBM. This is the new branch of laser where it is booming like anything. I can't concentrate more on PBM right now because it requires one full session for me on PBM. But the specialty is PBM is done, or biostimulation, photobiomodulation or photobiostimulation, or previously it is called as low level laser therapy, is only by diode laser. You can't use erbium YAG laser. It is for sure, because if you want to stimulate the photobiomodulation or photobiostimulation, you should require a photoreceptor and then do the photobiomodulation. Like most of you, if your elder parents are having, they will have joint pains or knee pains, means they will go for physiotherapy, right? Where they keep a red light on back so that it will have pain relief. Or you can see in many other supermarkets also now will get a LED light where you place in particular areas. In sports medicine also they use. That LED light is causing photobiostimulation. Same principle we are using in dentistry also. But that is a big separate topic that will be done only with diode only. Especially that phenomenon is useful in pain control. That process is called as photobiomodulation or photobiostimulation, which you can use by yourself also. You can try on yourself first. Even I tried on myself, it is working, 100% working. In bracket debonding, most of the times when orthodontist tries to debond the bracket, you will lose enamel or chipping of the enamel happens. If you use laser debonding, nothing will happen. And those who are having ortho braces, when initially they start the therapy, they feel pain. If you want to reduce that pain, use diode laser of PBM, 100% pain will be reduced. I can happily assure in that. The next comes to applications in perio. First, frenectomy, operculectomy, gingivectomy, depigmentation. You can do laser LANAP, you can do laser curettage, non-surgical therapy, including flap surgery also. All procedures can be done with laser. First, scaling. If we start, what is the advantage of laser scaling? Why you should use scaler instead of lasers, instead of you can use, which scaler can be used? Diode or erbium YAG? Why? Why erbium YAG? Why not diode? Every time I'll ask question why. Remember, diode always likes dark. D for D. It don't like white. Erbium YAG prefers hydroxyapatite and water. Your calculus is also made up of hydroxyapatite only. So you can use only erbium YAG, not diode. Diode never likes white. It always likes dark. Remember this. So D for D. But main advantage of laser scaling is first noise. If you use scaler, you should also sometimes close your ears. I mean, if you use scaling with the normal ultrasonic scaler, that sound. And don't make the patient to bath with water when you are doing scaling. That will not happen in laser scaling, because you don't use so much of water like how we use in our clinic. Sometimes the students will be bathing the patient in water only when you are doing scaling, and you can see the impression also on the back of the chair. I can 100% notice so much of water will be used. So don't make that bath of the patient. That can be prevented with this laser scaling. The main advantage of laser scaling, perfect, no noise. Major advantage is no sensitivity. Sensitivity will not be there after laser scaling, because you are not disturbing the underlying structures or not causing any underlying vibrations which will cause damage to the pulp. Got it? That's the advantage of laser scaling. Then laser curettage. This is what? Laser curettage. Both can be done with erbium and diode. This is the advantage. Main advantage, how to do with the laser curettage. pass the laser on the adjacent areas of the tissue, which will improve fibroblasts. If any periodontitis is there, I can 100% say, whenever you do laser normal curettage, patient says sensitivity, because you damage the root cementum, which will not happen with laser. You are not even touching any cementum, you will just remove the underlying calculus, so it will not cause any damage. So that's the main advantage. More reduction of bacteria, because bacteria is destroyed by the laser, and less pain and bleeding. These are the main advantages. The next, laser crown lengthening. Whatever I am saying is I am just rushing out, because each and every topic is a separate class for me. If you want to do aesthetic, this is called as aesthetic crown lengthening, where you should measure the crown. See, and in India, crown lengthening, they feel it is a simple procedure. There is one whole day session of laser crown lengthening, one full day, that is called as aesthetics laser crown lengthening, that is called as aesthetic periodontology, where you specifically do aesthetic crown lengthening. The topic itself is different. How to do the aesthetic crown lengthening, what are the different parameters, what is the lip position, the lip color, height of each crown. We should measure each part. That's called as, simply called as aesthetic smile designing, what we call as. So that concept is different. I can't say in detail, but this is what we do normal crown lengthening. We measure the width and height of the crown and then pass the laser that particular area, where we do the aesthetic crown lengthening. This is one of my student has done this case with diode laser. We require only 2 mm of tissue to be removed, only 2 mm. If you do with normal scalpel, you will expose the bone. 100% you will expose the bone, because 2 mm is very short. If you cut more than 2, you will expose the bone. So he had taken the laser and exactly removed 2 mm, which is possible only with diode laser or with erbium mag laser. There is no other option with scalpel in such type of cases. The next most important one is depigmentation. So this is the index of depigmentation, 1, 2, 3 severe cases. So this is the measurements for depigmentation, what we take generally. This is my case. I still remember this case because I did for anterior canine to canine. So the results are like this. Patient insisted me to do from molar to molar. I want from molar to molar, sir. I said no need, but no, I want, sir. I want from molar to molar. This is after 1 month. Perfect depigmentation can be done with, which laser is used for depigmentation? Which laser can be used for depigmentation? Erbium mag you can't use, huh? Why? Melanin cell will not have water. What is the attraction for erbium mag laser? Water. Water is present in every cell. You can use erbium mag laser also. There is no hard tissue laser can be used only for hard tissue or soft tissue. Soft tissue laser can be used for only for soft tissue or hard tissue. Hard tissue laser can be used for both hard tissue and soft tissue, whereas soft tissue laser can be used only for soft tissue, because the hard tissue laser example is erbium mag laser, which affinity is water and hydroxyapatite crystal. Remember, every cell in the body has water, so erbium mag laser can affect on every part of the cell, every structure of the body, whereas diode has affinity towards melanin and hemoglobin. So that's the reason you cut only soft tissue, not hard tissue. But if you intentionally damage it, some effect will be seen because of thermal damage. Some thermal damage, heat is there, right? So because of so much of heat production, you will necrose the bone. It is not straight damage. You will unnecessarily damage the tissue in the different way. Okay. So this is, one is with diode laser, one is with erbium mag laser. Which is the best laser for depigmentation? Which is the best laser for depigmentation? Okay, fine. You can see that is diode. This is erbium mag. Yeah, this is after 1 month. Now say which is best. Which is best laser? You can see both the pictures, right? Diode and erbium mag. Yeah, which is best? Diode. Okay, fine. Now see. After 2 years, yeah, In Indian scenario, diode is better, whereas in abroad we feel erbium YAG. Reason? Reason? No. Melanin pigmentation, that's what same style only. What do you see here? Recurrence. After 2 years, we can see slight pigmentation, right? Whereas not much of pigmentation here. Why? Why diode laser is not having pigmentation? Recurrence. Means recurrence is there, but delayed recurrence. Why? Every time I ask why. Can anybody say why this is having more recurrence when compared to this? I said no. I said just no. If you can think, you can say. I showed one slide of depth of penetration. Which is having more depth of penetration? Diode is having more depth of penetration because it will go till down, till the epithelium followed by connective tissue. Erbium YAG likes only water. Remember, that's the reason I gave your example of your lover or wife. Because erbium has always front wife, not at the back. Diode wife is always at the back. So diode goes till the last. Got it? So depth of penetration is more for diode. That's the reason recurrence is also less. Because you go deep and remove the tissue. Whereas erbium is superficial. But why foreigners prefer only erbium? No pain, no injection required, not even your topical spray. Just ask the patient to lie down, start with erbium YAG, because erbium YAG has water also. It will have some water. The water will come like how you have ultrasonic scaler. So automatically you will remove some amount of easily removal without any anesthesia. They are having money, they can come 10 times also, but they are fear of pain and injection. Simple for you also. I say I'll give injection for this procedure, I will say no injection for this procedure. Which will you say yes? Same thing. And second thing, erbium YAG, you can see here, it is more realistic when compared to diode. Diode will have more concentration, like a more patchy removal when compared to erbium YAG. So erbium YAG is superficial in action, but recurrence is more. If you want more money, use erbium YAG. If you want less money, use diode. Decide by yourself. Actually, to say in the books, you can see erbium YAG is given the best advantage when compared to diode. Best example is laser excision. This is also one of my case where patient is having front and back so much lesion extending from palatal to buccal like this. Patient is having a lip biting habit followed by that calculus. Remove the whole tissue post-operatively. Which is the best laser for this? This for this. Diode or erbium? Diode. This is completely soft tissue procedure. So it is a diode, not erbium YAG. Erbium YAG is not so indicated because you are close to the tooth surface. You may damage the tooth surface. For depigmentation, you are removing the superficial layer of epithelium. For that, erbium is better. Whereas if you are close to the hard tissue, use diode only. If you want to remove this tissue, you hold the laser with the, tissue holding forceps or artery forceps and cut it. Or if you just hold it with the tweezer or simply hold it and cut it, or simply cut it. Which is the best one? You understood my question? Suppose if you want not only this, any tissue, you have a fibroma, you want to cut the tissue, hold like this and cut it, or just lift it and cut it, or take an artery forceps and cut it. Which is the correct one? You understood my question? Yeah. Which is the correct one? Most of you will be doing in surgery, right? To remove the forceps and cut it. For laser, anything specific? Which is the correct one? Nobody understood the question? Understood or not? మీరు తీసుకున్న టిష్యూని పట్టుకొని కట్ చేస్తారా, కార్టరీ ఫోర్సెప్స్ ఏదైనా పెట్టి స్క్వీజ్ చేసి కట్ చేస్తారా, లేదా గమ్మని పైకి అట్లా పెట్టి కట్ చేస్తారా? దేంతో కట్ చేస్తారు? ఎట్లా కట్ చేస్తారు? ఎందుకు? రీజన్? వై నాట్ నార్మల్లీ? వై యూ లిఫ్ట్ అండ్ కట్ ఇట్? Okay, you can have normal correct boundaries, you can have lift it, you can see the boundary also, you can cut it, right? What is the use of artery forceps then? You can use the normal tweezer and lift it, you can see the boundary clearly and cut it. If the artery forceps is there, means you can't see the boundary also properly. Correct, okay, make the tissue thin. For that you can retract the tissue like this, right? Why to use artery forceps? ఎవరికైనా డౌట్ వచ్చిందా కనీసం మనం కట్ చేసినప్పుడు ఎలా కట్ చేస్తున్నాము, దానివల్ల అడ్వాంటేజ్ ఏమన్నా ఉందా అని? ఐ సజెస్ట్ యూజ్ అన్ ఆర్టరీ ఫోర్సెప్స్ అండ్ కట్ ఇట్. వై? ఇంతకు ముందు 100 సార్లు చెప్పాను, నా లవర్ నా పక్కన ఉంటే నేను పని చేయను అని. నా లవర్ దూరంగా ఉంటే నేను బాగా పని చేస్తాను. ఇఫ్ మై వైఫ్ ఈజ్ సిట్టింగ్ ఇన్ ఫ్రంట్ and ask me to say the session, I can't concentrate on my session because concentration will be diverted. In the same way, if you squeeze the tissue, the blood will be reduced. If the blood is reduced, laser will penetrate deeper. The depth of penetration will be increased by the diode laser because if you squeeze the blood, if attraction is more, laser will be taken and will not work. If attraction is less, it will work more. So reduce the attraction means squeeze the blood, automatically laser will penetrate more deeper. Understood? If the laser penetration is more, means if the body takes more laser, more damage happens. You want to cut the laser, not absorb the laser. If you want to cut the laser, attraction should be less. Attraction తగ్గించాలంటే బ్లడ్ తక్కువ ఉండాలి, తక్కువ ఉండాలంటే స్క్వీజ్ చేయాలి, స్క్వీజ్ చేస్తే పెనట్రేషన్ డీప్గా వెళ్తుంది. లేకపోతే ఎక్కువ లేజర్ తీసుకుంటుంది, టిష్యూ చారైపోతుంది. ఐ సెడ్ మోర్ అబ్జార్ప్షన్. మీరు ఆ క్రిష్ మూవీని గుర్తుపెట్టుకోండి, ఎక్కువ లేజర్ తీసుకుంటే పేలిపోతుంది బాడీ. లేజర్ తక్కువగా తీసుకోవాలి, ఎఫెక్ట్ ఎక్కువగా ఉండాలి. దట్ మీన్స్ దిస్ ఈస్ ఫర్ అబ్లేషన్. సో ఇఫ్ యూ వాంట్ టు కట్ ఎ టిష్యూ లైక్ దిస్, ఇఫ్ యూ స్క్వీజ్ విత్ ఆర్టరీ ఫోర్సెప్స్, డెప్త్ ఆఫ్ పెనట్రేషన్ విల్ బి మోర్. దట్స్ వాట్ ద లాజిక్ ఈస్. గాట్ ఇట్? Same thing. This is one of my patients where you see so much, generally we prefer flap surgery. Generally most common case for a flap surgery, but nothing done except laser. 2 times passage of laser, after 2 weeks you can see the post-operative. Nothing done, not even just scaling, curettage followed by laser, which we call as LANAP, laser assisted new attachment procedure, LANAP. Just pass that. Operculectomy, same thing, preoperative, intraoperative and post-operative. Tongue tie, laser is considered as a boon to pediatrician, because you see for a small 4 months kid, if you have a tongue tie, if you want to do scalpel, is it possible? Whereas with the laser, just ask the baby to hold the lip up, just make a cut with the laser, automatically tongue tie will be reduced. Because for tongue tie in a kid, it will cause lot of disturbance in phonation, milk sucking, all milk, they can't take the milk also because you can't get the vacuum. So automatically this tongue tie is very, laser is a boon to pediatrics, because in that time, because no pain, nothing, just give topical anesthesia, make a T-shaped incision, vertical, then make a horizontal, do, and patient can see the result immediately. This is immediate result. The tongue tie, you can see the movement of the tongue very easily. That's why I said patient can appreciate the treatment immediately. Whereas if it is with scalpel, you can't even place a blade there, it will bleed like anything. This is my first case where you see so much of what is this? Charring, blackness. Because at that time I don't know what's the movement of the laser. You can see still after 15 days there is still healing response going on. Whereas this is the recent case. This is a recent case which I done with 480 nanometer diode laser. Not even 1% charring, right? So that's what I say. Try to use the laser. Don't get fear of laser. Use the laser as much as you can. This is nowadays considered as the best procedure for laser hypersensitivity reaction. Laser we have done couple of studies with laser where, you know, graphite pencil, right? Graphite pencil. Take the pencil, take into powder, take the powder of the graphite pencil, not lead pencil, graphite pencil, mix it with water, place it and fire the laser. This graphite will cause occluding of the dentinal tubules after the laser application and reduce the hypersensitivity when compared to laser alone. You can see these studies are there. This is done by one of my sir. And we did one more study comparing with the graphite, laser, varnish and calcium, that is our toothpaste. Calcium carbonate toothpaste, arginine toothpaste. We found laser varnish immediate effect, laser prolonged effect. Means if you apply varnish, immediately there is reduction in hypersensitivity, but the action is not last longer. Whereas with laser, the effect was starting with it is a bit delayed, but the effect was for long duration. So if you want patient complaining of more hypersensitivity, first apply varnish and then fire the laser. You will get amazing results. Apply varnish and then fire the laser, you will get amazing results. This is one of the perio cases which we generally see when you use free gingival graft. You have a thickness. If you use laser, you will get a nice smooth collar. This is for peri-implantitis condition where you pass the laser into the peri-implant area and see the fresh bleed. Then automatically that peri-implantitis bacteria will be destroyed by the laser and you will get a perfect healing response. This is LANAP, laser assisted new attachment procedure, where you do, instead of, I think most of the periodontists are, you know what is flap surgery, right? Where you clean the, after curettage you open the flap, then curate it, close it and suture it. This is what we do. In LANAP, instead of opening the flap, you first clean it, pass the laser once again wait, then pass the laser once again. That's it, finished. My doubt is, you do the scaling, after that do the curettage and pass the laser, or pass the laser and then do the curettage. Which is correct? Understood my doubt? Scaling done, correct. Then you pass the laser and then do the curettage, or do the curettage and then pass the laser. Do the curettage and then pass the laser. Why not the reverse? Immediately my question is, why not the reverse? ఇప్పటికి 2-3 సార్లు చెప్పా అదే ఆన్సర్ మళ్ళీ ఇక్కడ కూడా వస్తుంది. ఇఫ్ మై అట్రాక్షన్ ఈస్ దేర్ ఐ విల్ నాట్ వర్క్. మీరు క్యూరెటాచ్ చేసిన మరుక్షణం మొత్తం బ్లడ్ వచ్చేస్తుంది. బ్లడ్ వచ్చిన మరుక్షణం లేజర్ పనిచేయదు. లేజర్ అక్కడే హ్యాపీగా ఉండిపోతుంది. లేజర్ పనిచేయదు. సో ముందు స్కేలింగ్ చేసిన తర్వాత ముందు లేజర్ ఫైర్ చేయాలి. పైనింటి కిందకి ఫైర్ చేయాలా, కింద నుండి పైకి ఫైర్ చేయాలా? అదే ఆన్సర్. పైనింటి కిందకే ఫైర్ చేయాలి. కింద నుండి ఫైర్ చేస్తే మళ్ళీ బ్లడ్ వచ్చేస్తుంది పైకి. బ్లడ్ వచ్చిన మరుక్షణం డయోడ్ లేజర్ పని చెయ్యదు. గుర్తుపెట్టుకోండి ఇది. వెన్ ఎవర్ ద బ్లడ్ కమ్స్, లేజర్ డయోడ్ లేజర్ విల్ నాట్ వర్క్. It will be taken by the laser and it will be happily staying there. You will not get the action required. మొత్తం సాకెట్ అంతా బ్లడ్తో ఫిల్ అయిపోతే మీకు కావాల్సిన ఏరియాలో యాక్షన్ ఎలా జరుగుతుంది? సేమ్ లాజిక్. సో ఫస్ట్ ఫైర్ ద లేసర్ ఫ్రమ్ టాప్ టు బాటమ్, డూ ద క్యూరటాజ్. అప్పుడు ఏమవుతుంది, మీరు ఫైర్ చేసిన టిష్యూలో ఉన్న మొత్తం డెబ్రిస్ అంతా బ్లాక్ కలర్లో చార్ అనేది మొత్తం క్యూరెట్తో తీసేస్తారు. దెన్ యూ విల్ గెట్ ఏ ఫ్రెష్ బ్లీడ్. అప్పుడు ఫైర్ చేయండి. దెన్ యూ విల్ గెట్ కోయాగులేషన్. నేను ఇందాకే చెప్పాను కోయాగులేట్ అవుతుంది 60 degreesలో. కంప్రెస్ విత్ యువర్ హ్యాండ్, దట్ విల్ యాక్ట్ లైక్ ఎ PRF అండ్ ఇట్ విల్ సీల్ లైక్ ఎనీథింగ్. యూ విల్ గెట్ అమేజింగ్ రిజల్ట్స్ ఆఫ్ LANAP. దిస్ ఈస్ విత్ మై ఎక్స్పీరియన్స్ ఐఎమ్ సేయింగ్. First fire the laser, then do the curettage, then once again fire the laser, then compress with your hand and automatically you will get the proper attachment. This is what the LANAP procedure is. Laser assisted new attachment procedure. అంతేగాని ఎలా తీసుకొని అలా లేజర్ అలా పాస్ చేసి నాకు రాలేదంటే రాదు. Use the proper protocol, then you will get. Which is the best laser for this? Nd:YAG, diode, erbium YAG. ఏది బెస్ట్? Nd:YAG, డయోడా, ఎర్బియం యాగా? థింక్ చేయండి. ఇప్పుడు నేను చెప్పిన పాయింట్స్లోనే ఉండదు, కొంచెం థింక్ చేయండి లాజికల్గా. ఫస్ట్ ఎర్బియం యాగ్. ఎర్బియం యాగ్కి ఫేవరెట్ ఏంది? వాటర్. సో బ్లడ్లో ఇమీడియట్గా వాటర్ ఉంటుంది. సో డెప్త్ ఆఫ్ పెనట్రేషన్ విల్ బి రెడ్యూస్డ్. డీప్గా పోదు లోపలికి. సో మనకు బ్యాక్టీరియల్ కంటామినేషన్ రిమూవ్ చేయాలి అంటే, పార్ఫెరోమోనాస్ జింజివాలిస్ ఇస్ ఏ టిష్యూ పెనట్రేటింగ్ బ్యాక్టీరియా. అది ఎక్కడెక్కడో టిష్యూలో అంటే లేజర్ ఇక్కడే తీసుకుంటే లోపల వరకు ఎట్లా వెళ్తుంది? సో ఎర్బియం ఈజ్ రాంగ్. నెక్స్ట్ ఈస్ డయోడ్ అండ్ ఎన్డియాగ్. విచ్ ఈస్ హ్యావింగ్ మోర్ డెప్త్ ఆఫ్ పెనట్రేషన్? Nd:YAG 1064 nanometers is having the deepest penetration when compared to diode. So Nd:YAG is the best laser. అందుకే మీరు కావాలంటే కరెన్సా బుక్ తీసుకొని చూడండి. Nd:YAG is considered as the best laser for లెనాప్ అని ఇస్తాడు. కానీ ప్రతి ఒక్క దానికి ఒక్కొక్క లేజర్ కొనలేము కాబట్టి అన్నిటికీ కలిపి దగ్గరగా ఉండేది డయోడ్. బికాస్ దట్ ఈస్ 1064, దిస్ ఈజ్ 980, ఆల్మోస్ట్ నియర్ బై ఉంది కాబట్టి డయోడ్ వాడతారు. గాట్ ఇట్? That is the reason diode is most commonly used when compared to Nd:YAG because of its depth of penetration and more durability, plus it is having photobiomodulation also, which I can't say now because that's a big topic. That property of photobiomodulation is only seen with diode. It is not seen with erbium YAG at all. Photobiostimulation antam, PBM antuntam. Photobiostimulation, PBM and photobiomodulation. Which laser is best for implant therapy, peri-implantitis? Nd:YAG is contraindicated because it will cause welding of the implant because of its heat. The best laser for peri-implantitis is erbium YAG laser. ఎందుకంటే సూపర్ఫిషియల్ అక్కడ మనం లేజర్ డైరెక్ట్గా ఇంప్లాంట్ మీద ఫైర్ చేస్తున్నాం. మనకు కావాల్సింది డెప్త్ ఆఫ్ పెనట్రేషన్ తక్కువ ఉండాలి, డీప్గా పెనట్రేట్ అవ్వకూడదు. అర్థమైందా? అండ్ షాక్ వేవ్ మెకానిజం ఇందాకే చెప్పాను, దట్ షాక్ వేవ్ మెకానిజం విల్ కాజ్ less penetration when compared to diode. This is one of my case which I still remember. The patient is 16 years old kid. చూడ్డానికి చాలా బాగా వచ్చింది. పేషెంట్ మెయిన్ కంప్లైంట్ ఈస్ మొబిలిటీ ఆఫ్ ద టూత్. నాకు ఇప్పటికీ మర్చిపోని కేసు. 14-15 years. See the OPG of the patient. 15 years girl where mother is afraid because all the molars are mobile. All the molars are mobile. Classic case of localized aggressive periodontitis case. All the first molars, still you can see the canine is erupting. All the molars, first molars are affected with arc shaped bone loss. Characteristic picture of aggressive periodontitis. మనకు బుక్లో చదివితే అట్లే ఉంటుంది. ఫస్ట్ మోలారు ఫస్ట్ సెంట్రల్ ఇన్సర్ మాటకి ఎఫెక్ట్ అవుతుంది. Patient is not at all willing for the surgery. 14 years or 15 years girl, how can she willing for the surgery of grade 1 to grade 2 mobility? That time I have only option left is laser. I passed the laser twice. This is after 2 years. See, I didn't even open the flap. Just pass it twice, not even once, twice. 2 cycles. అంటే ఒకసారి పాస్ చేసింది కాదు, మళ్ళీ పాస్ చేశాను. So twice. That's the advantage of the last one, photodynamic therapy, PDT. Same thing, instead of this we just pass the dye and then fire the laser. Same principle, everything is same except we pass the dye. The dye will be taken by the bacteria and you can when you fire the laser, reactive oxygen species will be taken like this. If you fire the malachite green, this is malachite green dye, when you fire the laser, automatically the bacteria which has taken the dye will be destroyed without damaging the adjacent tissue. This is called LAPIP, laser assisted peri-implant protocol. The same thing, same style, just instead of tooth you are using implant. Simple, same protocol of LAPIP. This I suggest to everyone who are doing in the surgery department to do this. Very simple protocol. మీరు అందరూ సాకెట్ ప్రిజర్వేషన్ చేస్తుంటారు. Most of the times when you extract the tooth you have a fresh bleed, right? Just take the laser 1.5 watt in a continuous mode, 400 nanometer, that is 450 diode, that is called blue laser. Remove the superficial epithelium just adjacent to the socket, fire the laser for 30 to 40 seconds. మొత్తం ఇట్లా బ్లాక్ కలర్లో కోయాగులేట్ అయిపోతుంది. You will get a perfect seal which will act like a socket preservation. Next implant పెట్టుకోవాలంటే హ్యాపీగా పెట్టచ్చు. Instead of doing a PRF, taking a plug, having a suture, doing socket preservation, simplest procedure. But induce the fresh bleed. Don't do on the granulation tissue bleed. Fresh bleed to be induced. దాని మీద చేయాలి. అదొక్కటి గుర్తుపెట్టుకోవాలి. లాస్ట్ వన్, లేజర్ సేఫ్టీ. ఇంతవరకు just now we did about laser mechanism, the last laser safety. Remember these 2 points, maximum permissible exposure and optical density. We see in the afternoon, whenever you are using laser goggles, you see this OD, optical density. The optical density for a minimum laser should be more than 10 power 6, minimum that is. If it is less, at least 10 power 5. If it is less than that, don't use that goggles. Ask them to replace it. Company will not give less than 10 power 5. If it is less than that, you can't have laser filter capacity by the body. Maximum permissible exposure is the area that is having more laser light, where it will cause damage. That is called as MPE. So who are the persons who are in MPE should 100% wear the goggles and eye protection and hand protections. This laser comes under class 2. Our dental lasers comes under class 4. Class 4 lasers are dental lasers and all are dangerous. Compulsory eye protection and hand protection, skin protection is important, because of which dentists are more prone to eye damage rather than skin damage, because what we use in medical field, skin damage is also there, whereas in dental most of the time we are close contact with the surface area, reflection is more dangerous, eyes are most damaged. So never ever try to see the laser straight without goggles. Don't play with the laser, because it will damage, and the damage starts with this headache, watering, burning, popping sounds. This is the initial signs of laser damage. Still you don't concentrate, the last 4 are dangerous. Retinal damage, corneal damage and aqueous humor damage. This is the retinal damage which happened by the NDR laser. Blind only, no chance of recovery by the patient, 100% out. So these are the changes on the skin, but lucky enough dentists don't have that much of skin damage when compared to, but not to take so much risk. So the minimum should be 6 plus. 6 plus is the minimum, bare minimum, when you are using a diode laser. And whenever you are using laser, this signboard is compulsory. It's not like cakewalk and walk in and walk out. This signboard is compulsory, and the effect of the diode laser will be up to 3 meters. So around 3 meters you should have diode laser effect. So never try to do that. So these are the safety measures that are to be taken. Whenever you are starting a laser, check proper infection control, gloves, decontamination, goggles, all these to be present. Check the laser fiber whether it is cleaved properly or not. Have the low power laser, use proper water and airflow, and then if you are treating, measure and document everything. Because in abroad, if you don't document, if the patient asks laser, what you have done later means you should have proper solid proof, otherwise you can be sued. So these are the laser safety precautions that are to be taken, and be proud to be a dentist, because whenever it's a survey done, if you see a patient of a person, first you notice his smile, then eyes, then smell, then clothes and then hair. So first thing if you see in a other person, the first thing you notice is smile, not the hair, not the eyes, not the skin. So be proud to be a dentist, and thank you very much. And these are, if you still want to learn further, this is the course which is going to happen in next upcoming September 14th and 15th in Hyderabad. So if you are interested, that's a 2-day workshop. You can come to that workshop which is going to happen in Hyderabad in Conquers Academy. Every 2 to 3 months generally we do one workshop. So this is the previous workshop which we had done on June, I think, on June. So this is in Hyderabad, where we discuss exclusively 2 days, start from morning to evening only on different lasers, and same live demonstration and followed by certification by the concerned institution. So that is on upcoming is on 14th and 15th, and so thank you very much. I should thank Shivkumar sir, Karthik and other people, and thank you very much. Sorry for the delay, and I took some time extra, I think so. So thank you very much. Any doubts you can ask. No issues. Any doubt you can ask. Have a break then. See how tooth movement can be done by laser. Laser will not cause tooth movement, laser will enhance the tooth movement. Means when you pass the PBM, when you use the laser, especially the diode laser in particular wavelength, when you fire the laser, automatically it will cause tooth stimulation with the help of bone remodeling, not tooth movement, bone remodeling. Especially this is done in orthodontics, where you pass the laser. See what happens in your what is that, periodontally accelerated orthodontic tooth movement, which is called as vilcodontics, where you make a slits with the help of piezo surgery. You pass slits, right? You make a slits in the bone, and then you move with the help of orthodontics, right? That is normally periodontally accelerated orthodontic tooth movement. When you are using a laser, we cause PBM, photobiomodulation, where I just give one example of this is in the specialty of PBM is when you take laser light. I think, see, if you have a chromophore in your body, most of you have chromophores, right? Myoglobin, hemoglobin, all these are the different chromophores that are present in the body. When the laser light is taken by the body, the mitochondria will be stimulated. That is a normal light, right? See how you work fast. See, in the morning time, you just simply sit in the outside the house and try to sit in the infrared zone. Why? You take some energy and you work faster. They ask you to sit in the sunlight for vitamin D, right? What is happening there? Your myoglobin will be stimulated, and because of the laser, because of the normal light, and you work faster because mitochondria will be activated. The same principle of infrared therapy used in laser for tooth movement, where you pass the laser light, especially in the PBM mode, the cells that are present in the particular area, the bone cells, will take this laser light. Automatically the mitochondria will be stimulated and the bone deposition and bone formation will be enhanced. So your movement will be faster. Same thing will be there for pain perception also. That's called as photobiomodulation. That is like, I think Hall is also not liking my lecture, I think. Fine. So that causes the increased tooth movement when compared to normal, right? When you pass the laser, the bone remodeling will be enhanced by the body with the absorption of laser light and stimulates orthodontic tooth movement. The same thing we use for many cases. That's a specific zone called PBM, photobiomodulation, where it's a big class of it, so I didn't touch much of the laser. I just went superficially, I didn't see much of duty cycle because laser physics itself is a very big class. So I tried to make a brief outline of it. Okay. Anything else? Now you can ask easily, I think. Nobody can see you. You can ask any doubt, whatever doubt you have. Yeah, you can. Somebody is raising the hand. You can. I think now it is on. QR code. Same QR code only. Why? Anyway, it is scattering. Answer is, see this. Energy is measured in. Why it is not able to get it or what? People has changed something, I think that's the reason. Can scan this QR code, right? Got it? No. Okay. Got it? Now you got it? Fine, if you get it, okay, or else you can see. No issues. I think now you are getting it, I think. Got it? Yeah. Fine, that is the answer for that. Anyway, scattering is the answer. So scattering is the answer. Energy is measured in joules. Yes, correct. Energy is measured in joules. So almost everybody understood a bit, I think. from my lecture? So everybody 100% saying joules. Okay, fine. Yes, it is the joules. So power is equal to, yeah, you can scan and you can just vote it there. 100% correct. Power is equal to energy by time. Yes, 100% correct. So now whenever you are doing any procedure, remember, don't increase the power unnecessarily. I am saying unnecessarily. If sometimes there is option you should increase the power, but whenever you are doing a laser procedure, try to reduce your hand speed rather than increasing the power. That's my tip. Then yes, exactly, it is energy by time. So which laser is best for depigmentation? Yes, hard tissue, soft tissue. Oh, still confusion. Actually, according to the book, it is not soft tissue, it is hard tissue. It is not diode laser, it is erbium YAG laser, because they see more pain perception is more when compared to recurrence rate. So, according to European standards, they say erbium is the best, and according to the naturality, more erbium is more natural. So, soft tissue is the hard tissue is the correct answer, not the soft tissue. Laser with high depth of penetration. Yes, Nd:YAG. Nd:YAG is the correct answer. Yes, Nd:YAG is the correct answer. Erbium is having the least depth of penetration when compared to all the other lasers. Yes. Laser contraindicated in implants. I said this answer. Oh, who said diode, Baba? Diode is the one of the best tools of laser which is used in peri-implant protocol. I said LAPIP also, laser assisted peri-implant protocol. So diode can be used. Nd:YAG is contraindicated. But still, when compared to all the lasers, they say erbium YAG laser is the best laser for peri-implant protocols when compared to diode also. Because diode also can have some damage. So answer is Nd:YAG. Hard tissue can be used for? Yes, both hard and soft tissue, not only soft tissue. Correct, correct. That's the answer. Hard tissue can be used for both hard and soft tissue, whereas soft tissue laser can be used only for soft tissue procedures. Correct. Which mode of laser is best for ablation? I mean to say cutting. Yes, you are right. Continuous mode is always contraindicated for ablation. Pulsed mode is always safe and the best mode. Still somebody is having doubt in continuous mode. Okay, fine. It's pulsed mode. Diode laser damages which part of the eye? Yes, diode laser damages the retina of the eye, whereas the erbium YAG damages the cornea of the eye. Because cornea has water, so automatically the whole laser is taken. When you are using erbium YAG, cornea is damaged, not the other parts. For blue laser, the minimum OD for eye optical density for eye protection is 6. Right. I already said minimum of 6 is compulsorily required, or OD protection is required when you are using a blue laser of 450 nanometer. That is the bare minimum required. If it is less than that, you have enough. At least 5 should be there. Some companies say 5 plus. 5 plus is also considered as okay. The laser with best coagulation mechanism is? This I didn't say, but I said in the lecture. If you can think, you can say. Yes, you are right. Diode is the best laser for coagulation mechanism. Correct. So, oh, some people answered 11 out of 11. Fine, okay, anyway, thank you. Keep it up. And congrats. Fine, okay, I don't want to say. Congrats then. Keep it up. Fine. Thank you very much. Thanks a lot. We'll see in the afternoon or what are the next session. We can have the live demonstration followed by hands-on.
Let us have a 15 minutes refreshment break. See you back in 15.
అవసరం లేదు 4కి అవసరం లేదు తను అసలు రాలేదు 9 o'clock ట్రైన్ డైరెక్ట్గా నేను వెళ్ళినాక 6:30కి చెప్పినా సార్ 2 hours అంటే ట్రాఫిక్ చూసుకోండి ముందే చెప్పండి ఇక్కడ ఎట్లాగో 4:35 కల్లా అయిపోతుంది కదా 6:30 చెప్తాను సార్ మీరు అక్కడికి వెళ్ళి కొంచెం నేను కొంచెం రష్ అయ్యాను నాకు తెలుసు మధ్యలో ఎందుకంటే టైమ్ ఇస్ ఐఎమ్ సీయింగ్ ద టైమ్ ఇట్ ఇస్ గెటింగ్ క్రాసింగ్ మోర్ దాన్ 2 hours 11 దాటిపోతాను నెక్స్ట్ పాస్ చేశాను ఇట్స్ ఎ బిగ్ టాపిక్ నాకు షార్ట్ టైం ఇచ్చి పెద్దది అందరూ ఒక హాఫ్ అవర్ దిగేలా థర్డ్ ఇయర్స్ కష్టం పోస్ట్ గ్రాడ్యుయేట్స్కి ఈజీ థర్డ్ ఇయర్స్కి ఇది అర్థం కావాలంటే కొంచెం కష్టం ఇంటర్న్స్కి తీసేస్తున్నా just disconnecting everything. Okay. It's just you understood, at least the students could understood something. I think.
Well, answer. Good. 70% people act in 11 night. That means you reached.
For my self-assessment, no, my self-assessment at least there isn't some percent or not. Because they don't see their names. End and the last just end I kept their name. Otherwise I just blocked that also.
This is motivation.
Yeah. We'll go to implant room for now.
After having this. Now down best. Check it once ma. How it is focusing. Charger you want.
Hello. Implantology. Hello.
అంతే సార్. See, they can listen to me, right? అక్కడ కనపడుతుందా వాళ్ళకి? They can listen to me? Yeah, right. See, you can focus here first. You can focus? Right. See, whenever you start an procedure, I think they can hear me, right? So you can see open like this. So whenever you see the laser, you will have this specific 1, 2, 3, 4. 1, 2, 3, 4. Yeah. The standard protocol for any laser machine, there will be password protected. So compulsory the password will be there. Generally the default password is 1, 2, 3, 4. So this is the default password. Generally, any laser company keeps as a default password 1, 2, 3, 4. So once you start the procedure, there are 3 options: customize, procedure, and favorite. You keep simply procedures. So in that, already they are given implant. So this patient is already patient has an implant. So you want to uncover the implant. So implant uncovering. So already given. So the company has already set as 0.8 watts as average power. You can see at the bottom, this is peak power. This is peak power. Peak power is 2.4, but the average power is 0.8. Means the duty cycle, as I already said, you should calculate the duty cycle. So here already they mentioned in pulses. So if you want to raise it, you can raise it also, but I don't want to go much. So if you want, you can see, if you reduce 2 watts, duty cycle is 0.7 watts. Means though you are set at 2 watts, it's okay, sir, it's okay. Sir, then I will first finish the procedure, then I can do no issues, sir. Sean Deva, okay, fine. Yeah, you can take it out, sir. The patient will have pain unnecessarily, no issues. No issues, sir, no issues, sir. This is a special one, sir, the new one, 470, you can see 470, then you can see 980, 650. The previous one we used to have 450, 810, 980. There are 2 options in this. This is 470. This is the blue laser. So if you please 470 means that highest ablation for the patient. So then 650 is infrared for PBM, photobiomodulation. Generally we use that for photobiomodulation. This 980 is for LANAP. Laser assisted new attachment process, that one for disinfection we use LANAP for that. So if you want to ablate any situation, best is 470. 470 will fire like anything, and this is self-activating. No, doesn't require any activation tip, cork, all those things. Just directly you can fire the laser. Even for your post-endo? Anything. Self-activating tip. That's the specialty of, for endo disinfection if you want, I suggest you use 650 nanometer. Because an infrared zone is the best one rather than blue laser. The protocol is different, sir. We use a protocol of 5 seconds. Means whatever the working length you have, suppose if you have 15 mm working length, keep 1 mm short of the working length, 14 mm. From there, you fire the laser 5 seconds with 10 seconds interval, 5 seconds, 10 seconds interval, like this. We should give an interval time, because otherwise the tissue should cool down, sir. Otherwise it will char out. You will get damage to adjacent tissues. So minimum, if you fire the laser for 5 seconds, just set 1 second resting time for it. Then you once again fire it. Fire and rest, like this 5 cycles. With tone up, step back, 1 mm, again back. Then irrigate it. No need, sir. We can adjust. That is why there are 2 modes: expert mode and normal mode. This what I am doing is expert mode. I can use expert mode. Trying so many times. The company gives safe mode, sir. Safe mode is where we will not have any damage. Expert mode is where I have my own intention. I can change the expert mode. Suppose if it is not cutting, you want to increase the power, you can raise it. Or if you want to increase it, you can increase the average power. You can use the duty cycle more. I don't suggest to change initially, because they'll get confused with that. So initially use according to the manufacturer, but I can adjust mine. Suppose if it's not cutting, I can raise it. Visible, sir? Visible? Okay, done? Yeah, we'll start from starting. So, whenever you see the laser, you see like this. This is password protected. The password protection is to prevent unnecessary damage to the adjacent areas, or suppose by mistake if you fire the laser, unnecessarily there may be damage. So, everybody can't operate the laser unit. So, compulsory they should have password. Generally, the default password is 1234. Once you press the password, you will get like this. So in this customized mode, procedures and favorite. Customized is for those who are already expert. Means suppose I can customize my own settings. Whatever settings, I can keep one name and I can set my own settings. If you are known for it, which you know very well. If you don't know it, go to the procedures. In this patient is already done and with implant, and we want to uncover the implant. So implant, in this implant uncovering. So automatically, as I said, this is the pulse. Pulse, I said pulse period. Between two pulses, what the space is called pulse period. So they already kept pulse period and number of pulse, 1 millisecond. One pulse will be having 1 millisecond. So we have a space between one pulse to other pulse is 1 millisecond. So 2 milliseconds is the pulse period. So after one pulse, after 2 seconds, then you will get the one more pulse. That's called as pulse period. This is what 2 milliseconds. Okay. So this I am using 470 nanometer. That is a special blue laser which is having highest ablation effect. So that is the reason we have 470 nanometer, and they already set as 0.7 watts. It is more than sufficient. This is the peak power. Though the peak power, you can see peak power is 2 watts. But 2 watts will not be fired. Only 0.7 watts will be fired. So whatever the settings you want to change, you can change. Suppose if you want to reduce the watt, you can reduce. If you want to increase the watt, you can increase the watt. So generally 0.7 is sufficient enough. This is sufficient. Once you press ready, you can't change any setting, the settings will be locked out. Now you see, it will not move. Because once the settings are ready, you can see the tip will be activated. Before firing the tip, check for the round hue, what I said right now. See, you can see here round color shape is seen without any comment. You can see wait, you can see right now. And this 450 nanometers can work in contact and non-contact mode also. And everybody surrounding me are wearing goggles, including myself. I am wearing the goggles right now. Including the patient should be wearing goggles. Once you wear the goggles, you see the implant area. See this. We kept the cheek retractor, asked the patient to bite. I already given anesthesia for the patient. Noppunda andi? Noppunda? Let go. Hold it. Give the probe. 1 second. Hold the cheek. నొప్పుందా అండి? ఇక్కడ పెయిన్ ఉందా? వెళ్ళేయమ్మా. వెళ్ళే స్ప్రే కూడా ఇవ్వండి కొంచెం వీలుంటే. ఇప్పుడు నొప్పి లేదు కదండి? కొద్దిగా ఉంది అంతే. ఓకే ఓకే ఓకే. రైట్. 1 second. నొప్పి ఉందా అండి? పర్లేదు. నొప్పి మరీ భరించలేకుండా ఉంటే చెప్పండి నాకు, ఓకేనా? సెలైన్ ప్లీజ్. అంత నొప్పి అని ఉంది ఇప్పుడు లేదు కదండి? రైట్, అది అది దిస్ ఈజ్ ఎ స్పెషాలిటీ. యూ సీ పేషెంట్ నౌ నాట్ ఫీలింగ్ ఎనీ పెయిన్. ఈ గాజ్ కూడా సెలైన్ డిప్ చేసి ఇవ్వండి అమ్మా. This tip is 400 nanometer tip. What we see is 400 nanometer. There are 3 tips here, 200 nanometer, 300 nanometer and 400 nanometer tips are present. Generally we use 400 nanometer tip for ablation, 200 nanometer tip for endodontic root canal disinfection, 300 nanometer tip for other procedures where you require minor procedures which doesn't require so much of space. Ablation is 400 nanometer, most commonly 400, sometimes 300. Whereas 200 nanometer tip is only for root canal disinfection, most because a smaller narrow tip, and it will be color coded. You can see here also this will be pink in color, whereas the other two, one will be blue, one will be green. So easy to do that. I will show the other parts of the laser once you come for the hands-on, but right now I am just showing this because this is a 400 nanometer tip, and here the company also says that you should use 400 nanometer tip, and you can see how much time, how much energy, how much off time. This is on time, this is off time. So if you are firing laser, you have 1 millisecond on time, 2 milliseconds off time. So the energy is 8.4 joules. We are using so much of energy for 1 beep, 1 second. Okay, points on watts is the average watts which we use to cover the, uncover the implant surface. You can see the sloughing here, slight sloughing is happening. See, slight sloughing is happening. So once sloughing is there, you can see no charring. You can see there is no blackness, only white slough will be formed, not other things. Because sloughing is common. Just a squeeze chesi chesi. Every time whenever you are using diode laser, try to cool the tissue, because you should always dampen with saline and then only we should use the laser. You can see the tissue. I should clean every time, I should clean the tissue, I should clean the surface of the wound. క్యూరేట్ ఉందామా? Yeah, you can see slowly the implant is getting uncovered. You can see here the metal substructure, right? Open. కొంచెం తెరవండి. sir, 3 mm, 3 mm width, height of the implant, width of the implant, sir. Apartment you placed, okay. Okay. The main advantage is there is no bleeding, you see. Nothing bleeding, no bleeding, nothing. I am just simply cleaning the tissue and slowly removing the tissue. No, because this is a soft tissue laser, nothing will happen on the metallic surface. You can see, is there any bleeding? Cross check it. Any bleeding is there? Too much of charring? Nothing. Just you can see the blood area, very, very minimal. Hardly you can see a dot somewhere. But you can see the clean apartment surface right now. Still I am removing layer by layer. The main advantage of it, you should not do it one shot. If you do one shot, the tip will break. Slowly, layer by layer only, you should remove it. That is the main advantage of laser. And I didn't touch the metal surface. I am going close to the surface of the implant. This part is a soft tissue area. Patient is feeling pain, I believe. Spray, please. He is feeling pain on the palatal aspect, not on the buccal aspect. Hold it. So palatal aspect, I should give a bit anesthesia because buccal aspect is normal. Because easiest on the buccal aspect, but palatal aspect, as it is anterior, patient is feeling mild pain because of the కొంచెం నోరు తెరవండి ఆనండి బాగా నోరు తెరవండి అయిపోయింది ఇంట్రాలిగమెంటరీ ఇస్తున్నారు కొద్దిగా నొప్పి ఉంటుందండి అయిపోయింది ఆనండి ఆల్రెడీ ఇచ్చాను సార్ మత్తి ఇస్తున్నా ఫుల్గా ఇస్తున్నా ఆగండి సార్ అయిపోయింది ఓకే because of LA you feel the bleeding. Right now there is no bleeding. Now you can see the multi-unit apartment very clearly, right? You can see the apartment very clearly. Can you give the probe, please? Yeah. So you should mark where is the apartment now. So this is the tissue which is getting already cleaned out. So clean that area properly. See, the tissue tags to be removed which are already cleaned out. See, this part of the tissue has to be cleaned out. So patient is feeling pain here, not because of apartment or what, I don't know why. Patient is here, no pain. In the palatal aspect, patient is feeling pain. I don't know why. I don't know what angle you place the implant, but right now, buccal no pain at all. See? Anyway, okay. Every time clean the tip properly. That is the most important protocol to be followed. Clean the tip properly. Then only
After doing this, what is the average healing period?
10 to 15 days. Minimum 10 days time will take. If there is less bleeding or all those things, definitely. I suggest sometimes to induce bleeding a bit because it heals faster. I don't know why patient is feeling more pain on the palatal aspect. See. He's not feeling pain on the buccal aspect. He's feeling pain on the palatal aspect. I don't understand. 1 second. Hold it. Relay, please. Suction. అంత నొప్పి ఫీల్ అవుతున్నారు ఆనండి ఆగండి అయిపోయింది ఆగండి అంత ఇంటర్నల్ పెయిన్ ఫీల్ అవుతున్నారు వెళ్ళే స్ప్రే కూడా తీసుకోమ్మా ఇంత పెయిన్ ఫీల్ అవుతున్నారు ఎందుకని అసలు టాపికల్ సరిపోతుంది ఇంత నొప్పి ఎందుకు ఫీల్ అవుతున్నారా ఇప్పుడు చూడండి సార్ నొప్పి తగ్గిపోతుంది పూర్తిగా తగ్గిందా ఇంప్లాంట్ పెట్టుండేది జస్ట్ క్లీన్ చేసి పైకి ఓపెన్ చేస్తున్నాం సార్ అంతకుమించి ఇంకేం చేయట్లేదు మేము కంగారు పడకండి Curate, please. ఇదిగోమ్మా, the total tissue is exposed out. ఓకే, సో సార్ చెప్పినట్టుగా మల్టీ యూనిట్ అపార్ట్మెంట్ మొత్తం తీసేసాను. పెరటల్ ఆస్పెక్ట్ చేయాలంటే పేషెంట్ కొంచెం ఎందుకు పెయిన్ ఫీల్ అవుతున్నారు. ఒకసారి బ్లాక్ ఇచ్చి చేద్దాం. ఇక్కడ తీయాలి, యాక్చువల్గా ఇక్కడ తీయాలి అంటే పేషెంట్ ఐ థింక్ బోన్ దగ్గర అన్న ఫీల్ వచ్చి ఇక్కడ ఫీల్ అవుతున్నారు, పెయిన్ ఫీల్ అవుతున్నారు పేషెంట్. అసలు టిష్యూ అయితే రిమూవ్ చేసేసాను మొత్తం. ఇదిగోండి, ఈ పార్ట్లో పెయిన్ ఫీల్ అవుతున్నారు ఎందుకు. ఇదిగోండి ఇక్కడ పెయిన్ ఫీల్ అవుతున్నారు. పట్టుకోండి, ఓపెన్. వెళ్ళి తీసుకోక సార్, ఇంకొక యాంగిల్ వచ్చి చూస్తాను. ఆగండి, అవునండి. అవునండి, అవునండి. అవునండి, ప్రాబ్లం అనస్థీషియా కాదు, సమ్ ప్రాబ్లం విత్ ఇంప్లాంట్ ప్లేస్మెంట్ ఆర్. అవునండి, ఎందుకంత పెయిన్ ఫీల్ అవుతున్నారో చెక్ చేస్తున్నాను. ఇప్పుడు నొప్పి లేదు కదండి, రైట్. గ్రేటర్ పెల్టన్ నర్వ్ బ్లాక్ ఇచ్చేసాను ఇప్పుడు, సో నాకు తెలిసి ఇంకా పెయిన్ ఉండదు. జనరల్గా బ్లాక్ ఈను, బట్ దిస్ పేషెంట్ పెయిన్ సబ్స్టెన్స్ ఈస్ మోర్, సో ఐ థాట్ ఆఫ్ గివింగ్ ద గ్రేటర్ పెల్టన్ నర్వ్ బ్లాక్. సో ఇప్పుడు అది ఇచ్చాను, సారీ నాసో పెల్టన్ నర్వ్ బ్లాక్ ఇచ్చేసాను. సో నాకు తెలిసి ఇంకా పెయిన్ ఉండదు పేషెంట్కి. గాస్ ప్లీజ్. Once if the patient feels any pain, better give the block. Because nasopalatal nerve block is because patient anterior front buccal surface pain feel అవ్వట్లేదు, palatal surface pain feel అవుతున్నారు. palatal surface pain feel అవుతున్నారు, at the same time tissue thickness కొంచెం ఎక్కువ ఉంది. So at the same time tissue thickness ఎక్కువ ఉంది అనుకున్నప్పుడు then you raise up to 0.8 watt. So this is the actual recommended by the company, 0.8 watt, and I kept 0.8 now. So now open sir. Clean the tissue first properly. Every time whenever you are starting, clean the tissue. The tip should not have any charred tissue. Once the tissue is charred, automatically it will fire improperly. Open. Bath everyone sir. See, if the patient is cooperative like this, then we can do the procedure easily. If the patient is moving means
then the anesthesia is not sufficient and the patient is feeling pain. So once the tissue is charring, so clean the tissue, automatically clean the area with the wet gauze so that the heat should be dissipated. Then once again fire the laser in a layer by layer. Open. Curate please. అయిపోయింది. All these tissue tags to be removed whenever you are doing the laser. So if you want to fire the laser properly, remove all the tissue tags. So once you cut the tissue tags, then only you can see the underlying compartment very clearly. See. See. Now you can see the multi-unit compartment very clearly on both the sides. See. So just now when I did curate, you felt the bleeding. After curettage, you felt the bleeding, but till now there is no bleeding at all. And you can see the surface of the wound is very clean. If they want to stop that bleeding also, if you don't want that minor bleeding tendency also, open, clean the tissue first. Once, every time you should clean the tip, because laser firing is very important. Open. That tissue you want to remove, sir? Every time after you see, after 5 to 10 seconds, I will stop the laser, clean the particular area, clean the tip. Once again only I will fire the laser. Because the heat should be dissipated and the area should be cooled down. If you keep on heating the tissue will get necrosed. Every time you see, I will be using wet gauze to clean the area, clean the total area, expose the wet gauze area, and then remove the tissue tags layer by layer. Cautery will cause unnecessary depth of penetration you don't know, sir, and will unnecessarily cause damage to the adjacent tissues. That's it. Hold it. If we see from the first area where we started and now where we landed, I didn't even use anything, just only one curate to remove the tissue tags like this. These tags are there which will hinder because it's a hard tissue, very hard at the palatal aspect. So I tried to remove these tissue tags with the help of the curate, because though laser has removed that, but you can see this tissue tags will be hindering. So I'm curating that area to remove the tags which are present here. That's it, nothing else. Because once you clean that area, gauze can't go deep into that area because the tissue is very hard here. So I'm just using the tissue tags to clean that area and remove. See, and just removing those tissue tags which are present, which are hindering the area. That's it. See, now you can see the whole apartment very cleanly. With laser it is less when compared to scalpel, because 100% laser is best, because with cautery your adjacent tissue will be damaged and you will get bad smell when doing the cautery. That smell will be very charring smell and patient can't bear it. That smell as if something is burning. Whereas with laser you don't feel that smell, first of all. Second thing, you can see the clean wound without any too much bleeding, as if nothing running from that. And the third thing, when you necrose this area with the small charring that happens, that will prevent further growth immediately. Tomorrow you can fix, happily you can remove and you can do it. No issues. Nothing, no bleeding, no gauze, nothing required. Just leave the patient, automatically go off, finished, happily. See, the whole tissue I removed with exposing without anything. Clean tissue. Now, when you started, you didn't even see one apartment also. Now you can see the whole unit very clearly. Okay? Right. Which side, sir? Which side you want more? This side. That side you want. Okay. Fine, fine. We can remove that. No issues. Here you can see, as sir asked me, the tissue thickness is bit high here. Growth is very high, strong. So, if you want the strong tissue to be removed, you raise the watt up to 1 watt. First make it standby, make the peak power up to 1 watt. Average power should be 1 watt. So once average power is 1 watt, sir asked me to do on the mesial distal aspect of the implant area, this area, because sir wants a bit more on the distal aspect. So same procedure, once again clean the area, take the new gauze, generally we will not have so much time, but for you to explain and to see that particular area I am taking some time, because you will do very fastly, we will not have so much of time here. So generally fire that area, see, fire that area, clearly fire that area, over. Now this tissue will not grow, finished. Finished. The tissue will not grow for sure. See, the tissue will not grow for sure. Now, once you finish, keep it, take the curette. Curette should be done because to remove the tissue, excess tissue tags that are present here. Whenever the tissue tags are there, see, this black tissue tags which are there should be removed. See, I am not doing anything, just removing those tags. See, see. See, those tags I am removing, nothing much. That will induce in two aspects. If you remove the tissue tags, slight bleeding will be induced, not too much heavy bleeding, minimal bleeding. That will help in healing response, faster healing response. And second thing, see that whole area is removed. This excess tissue tags, you remove it. This. Okay, right. Okay, then we'll see the next case then. Okay, listen. We will finish the depigmentation. Okay, we can do it. Okay. Which angle A direction, sir? Patient palatal aspect lo koncham pain feel avutunnaru. I don't know what aspect, what's the reason for it. Okay, I didn't see the X-ray previously. She had taken the fine, no issues. No issues. Done. Already done. Anyway, I exposed it. I want to show how the laser works. So see. Now see the previous exposure and now see the canine. I had removed from here this length to this length without even one bleed. Happily removed. Okay, Nana? ఇబ్బంది ఏం లేదు. ఒక అచ్చు తీసుకుంటారంట, తీసేసుకొని పంపించేస్తారు. Is it visible? See, whenever you want to stop, first make it to standby. If you stand by, you press anything, the laser will have no effect on adjacent areas. And not only this, see procedures, when you open the procedures, there are multiple procedures like this. Suppose if you want to do perio, open the perio, you will get a list, soft tissue pocket reduction. So open it, automatically you will get it. So all the laser settings which are given there are completely present here. If you want to do circular debridement, 0.7 watts peak power, 0.7 watts average power. Because circular debridement is removal of the bacteria that is present in the sulcus. You are debriding the curettage. So you want to remove the bacteria. So it is shown in continuous mode. You are not cutting any tissue there. Debridement is removal of the granulation tissue like curettage. So that's the reason it is in continuous mode. Suppose if you want to do gingivectomy, I think procedures, perio, surgical, yeah, gingivectomy. See, peak power, average power. It is 1.3, 1.3. This is wrong. You should not move in continuous mode. Make into pulse. This is correct. Because any ablation procedure, if you want to remove gingivectomy or crown lengthening, you should always do in pulsed mode, not in continuous mode. Keep into continuous mode. Sorry, keep into pulsed mode. So automatically you can keep up to 1 watt. Don't see this average power. So average power is 1 watt, peak power is 2 watts, means the duty cycle is 50%. So only 50% of the time the laser is fired, 50% laser is off. If you still want, you can reduce the duty cycle still more. If you still want to reduce it. So like this, operculectomy, any procedure, you can do any procedure. No issues. Make it to 450 watts. Instead of continuous mode, make it into pulsed mode. That's it. Got it? So if you want, you can customize the procedures for endo. Where is endo? So endo germ disinfection. So see, the 8 milliwatts, very, very less power. And automatically, this is the S3 model. There is one more one where I can show you. You can see clearly the tip also. See, fiber type, 200 micrometer. You can see here 200 micrometer tip is given. That means 200 nanometer tip, the small tip, the green color tip. This is 400 nanometer tip. This is pink color 400 nanometer tip. Whereas this is 200 nanometer should be green color. Ramna, green color tip iva. Green ఇంకొకటి కూడా రెండు బ్లూ కలర్ రెండు ఇచ్చేసా ఒకసారి 200 300. Yeah. See, this is 200 nanometer tip. You can see the tip thinness, very thin tip. This is 300 nanometer tip, a bit thicker. This is 400 nanometer, a still more wider. So you can see the tip diameters, right? See, this is very thin, a bit thicker, a bit thicker. You can see 3. So this is 200, this is 300, this is 400. And in order to avoid confusion, see, blue color, green color, pink color. All colors are given, color coded, so you can happily use it. Okay? పడుతుంది పెట్టేసి పడుతుంది యా అవునండి ఫిక్స్ అయింది నా ఫస్ట్ టైటన్ ఇట్ ఓకే నెక్స్ట్ ముందు అది ఫిక్స్ చేసుకో కరెక్ట్ రైట్ పెట్టేసి ఆనండి కొంచెం ఆనండి నేను పట్టుకుంటే ఆగినాను ఆనండి Oh, sorry. అవునండి, సారీ చూడలేదు. సారీ, నాకు ఇది కనపడలేదు, తను చేయడం వచ్చేసరి. ఓకే, ఈ లిప్ కనపడలేదు. ఓకే, లేసేయండి సార్, ఇంప్రెషన్ అచ్చు తీసుకునేస్తారు 2 minutes. నోరు ముయ్యొద్దు, తీసేసాను. వచ్చేసేయండి, అయిపోయింది. The main advantage of that laser procedure is, though it takes time, I just want to show you because I went a bit slow. If I do faster, you can't see what I am doing. Second thing, you can see no bleeding whenever you are unscrewing, screwing, no bleeding at all. Whereas if you do with scalpel, you can't see the vision. First of all, it's completely filled with blood field. Now you can see the field clearly, right? Where is the exposure required or not, and it will heal faster. And you will get a nice gingival cuff because I removed only edges. If it's scalpel, I will cut more because I want more tissue to see, and bleeding will be there. Though how much you control, the implant will be contaminated because of the bleeding, because blood will go inside the sulcus. No bleeding, no patient will not have that much, but here the patient tissue thickness is more, so I gave more of anesthesia. As patient is feeling more pain, I give nasopalatal block. Generally, I will not give block, I will give only infiltration. As the patient is feeling more pain here, I give block. That too nasopalatal. Buccal side no pain. Palatal side is feeling mild pain because he is moving that side, this side. So I give once nasopalatal block, he is happy. That's it. So that's the advantage of laser. And you can see every time I will do one side by side, I will be keep on cleaning, I will be keep on doing in the one aspect. Right? Can I have the depigmentation case? We will finish up that. Yeah, my pleasure, sir. Depigmentation will come under aesthetic procedures. So it will be under aesthetics. So depigmentation, yeah. Meeke ichchanamma. No, take it. Sorry. No, driving itla easy avutha. It's okay. కట్ చేసేయండి. నో టిప్ మార్చేసేయండి, ఇంకో టిప్ తీసుకోండి. న్యూ పేషెంట్ కదా, పర్లేదు. ఇంకో టిప్ ఉంటే తీసుకోండి. టిప్ ఇంకోటి తీసుకోండి, పేషెంట్ కదా, స్టూడెంట్ అంట, ఇంకో టిప్ తీసుకోండి. కొత్త టిప్ ఒకటి తీసుకోండి, ఏమవుతుంది. ఓకే, ఓకే, స్టూడెంట్ కాబట్టి నేను ఇంకా కేర్ తీసుకోవాలి అప్పుడు. ఫైన్, నో ఇష్యూస్. యూ కెన్ ఆల్సో సీ మా ఐఎమ్ కీపింగ్ depigmentation procedure. You can see here, see whenever you want to do any procedure of depigmentation, it's an aesthetic procedure. So 1, 2, 3, 4, first open it, then procedures. In the procedures in aesthetics, because it's an aesthetic procedure, go to aesthetics, depigmentation. So go to depigmentation. So in these two options, you can do in 470, you can do in 980. If you do in 470, make it into pulsed first pulsed, no continuous. Pulsed, make it into 1 watt, 0.9 to 1 watt, 470 nanometers. Keep it in pulse, ready, make it ready. And if you want to still reduce the pulse period, you can take it, you can adjust it. But I don't want to use so much of confusion for you, I just make it okay. So like this, so make it to 1 watt. Right, now fine, lie down. Kotta tip pettava? 400 nanometer tip pettese. This is very easy. What he is doing is right now, when you want to remove the tip, see, you can see here clearly 400 nanometer tip. This black dot is for initiation of the tip initiation actually, but for 400 nanometer we doesn't require that, sorry, For a blue laser, it doesn't require tip initiation. If it is a 650 or 980, we should require tip initiation. So, open the tip. It's just like this. Remove this, place it, hold it. Fix it. That's it. Once it is set, once it is ready, you see the red light. If it is in standby, that will be off. So everything is set here, make it ready, you will see the light. Okay? Now once you see this, keep it like this, make it in standby. First prepare the patient. Get me the gloves, new gloves please. Ian Nana, Ganesha. Open. Okay. So they want to use this part, canine to lateral, central to canine, right? Okay. Each side dento chesaru? Lasers. Ye laser?
Not lasers, human beings. What
Sir, vitamin C, sir.
vitamin C we have done.
Sir,
Okay.
vitamin C, that side, sir, it's lasers.
One second. You are showing reverse. Lie down, lie down. Lie down, lie down, lie down, lie down, lie down. Get the mirror.
Depigmentation is there.
Hold it. Hold it. Yeah, that is on the right side, not on the left side. Mirror, 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 normal mirror. Plain mirror. Addam, addam, addam. You already, this side is done. This side to be done. You are showing exactly reverse. If you want, I will show it to you. Wait. Photo disco poni. Photo disco. That's the correct option. Good idea. Open. Open. ఏం కాదు వదిలేసి చూపించు చూడు ఇటు సైడ్ చేశారు అటు సైడ్ చేయలేదు
Side vitamin C, sir.
చేశారా అంటే అసలు ఏం వర్క్ చేయలేదు అక్కడ ఫెంటాస్టిక్ అప్పుడు ఇటు సైడ్ ఏం చేయలేదా
It's a laser, sir.
ఎవరితో ఏ లేజర్ చేశారు ఇంతకుముందు but frankly to say sir, whatever she is saying, vitamin C is not working sir then I will do on this side amma, because one side is pink, one side is not pink, so I will do on this side. Okay, fine. Yeah, open. So that means that laser is super fast then, so still no recurrence, so already proven, so no need to do one more. Fine. Topical anesthesia. నేను కొంచెం ఎల్ఏ ఇస్తాను నాన్న, లైట్గా ఎక్కువ ఇవ్వను, వెరీ మినిమల్గా ఇస్తాను. ఓపెన్ 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 నోరు తెరు ఓపెన్ ఓపెన్. ఓకే అవునా, స్పిట్ ఇట్, యూ వాంట్ టు స్పిట్ ఇట్, యూ కెన్ స్పిట్ ఇట్, నో ఇష్యూస్. అది తీసుకో. Okay. I don't want to comment one, but one small mistake happened there. Okay, leave it open. Bite. Right, super. See, one small thing happened was there is a pigmentation on the papilla. That should not be there. If I do that, then that will become more pink now. So anyway, that is a different issue. LA please a bit. లోడ్ చేయండి కొద్దిగా, కొంచెం ఇన్ఫిల్ట్రేషన్ ఇస్తాను, లైట్గా, ఎక్కువ ఇవ్వను, మైల్డ్గా. సో ద మెయిన్ అడ్వాంటేజ్, ఐ వాంట్ టు షో టూ థింగ్స్ ఇన్ దిస్. వన్ సెకండ్. I will do from canine to central. Okay, only these 3 teeth. If you want still, I can do lower full also, up to you. If you want means I will do that also. చేసామంటే కింద కూడా చేసేస్తాను మొత్తం, canine to canine. అప్పుడు 2 సైడ్లు వెళ్ళే ఇవ్వాలి, నీ ఇష్టం, నువ్వు చేయమంటే చేస్తా. Just go to the mucobuccal fold a bit, give slight infiltration of anesthesia, not much. Enough. That's it. Enough, sufficient. Hold it. పెయిన్ ఉందా? అంత భరించలేదు, ఏం లేదు కదా? ఓకే. Gauze, wet gauze, wet gauze. వెట్గా ఉందా? రైట్, ఓకే. 1 సెకండ్. ఇంత అవసరం లేదు. ఓకే. నేను ఎక్కువ స్ట్రెస్ ఫీల్ అవుతున్నా. ఓకే. స్పెక్టికల్స్ ప్లీజ్. Goggles. Specs. The main advantage of this is, you can see I started already hemangioma gatali depigmentation. See, depigmentation make into pulsed first 1.5 watt. Still I suggest for depigmentation is not so high. So you may reduce it to 1 watt, sufficient. 1 watt is sufficient. Average power, don't see the peak power, see the average power. Average power is the which you should see. 1 watt, make it into 470 nanometers. So 470 nanometers, 1 watt, sufficient enough. Okay, see 470 nanometers, average power 1 watt, depigmentation, start the procedure. Okay, the main specialty of this is, you see here, నాన్న నీకు నొప్పి ఉంటే వెంటనే చెప్పేసి చేయి పైకెత్తి కాపేస్తాను, ఓకేనా? యు సీ, యూ కెన్ సీ దేర్ ఇస్ డిస్టెన్స్, రైట్? కనపడుతుందా? ఐ డెంట్ టచ్ ద టిష్యూ. యూ కెన్ సీ హియర్. యూ కెన్ సీ ఐ డెంట్ టచ్ ద టిష్యూ. ఎగ్జాక్ట్లీ 1 millimeter ఐమ్ అవే. See the effect? I didn't touch the tissue. I am away 1 millimeter. కనపడుతుంది, ఇక్కడున్న వాళ్ళకి బాగా కనపడుతుంది అనుకుంటాను. See, ఇక్కడున్నాను నేను, but I didn't even touch the tissue. But you can see, this is called as non-contact mode ablation, which can be only done with 470 nanometer. You can't do this in 980. ఇప్పుడు నేను 980లో పెడితే ఇది పనిచేయదు మళ్ళీ. 470 nanometer has a specialty of no need of activation. It can be worked in non-contact mode. The main advantage of non-contact mode is these areas. If it is in contact mode, if I scrape it, I don't know how much I peeled out. In non-contact mode, I can see the tip of the papilla very easily. That's the main advantage. Second thing, see, you can work in contact mode also, no problem. Go Kazima. Hold the tip, engage the area, do in a sweeping motion. నొప్పిందేనా? కదలద్దు, ఉంటే చేయి పైకెత్తు, అంతేగాని కదలద్దు. See, you can see the layer, peeling of the layers, right? You can see here, right? Superficial epithelium is peeled out. నాన్న ఏమాత్రం పెయిన్ ఉన్నా నాకు చెప్పు, ఓకేనా? నువ్వు కదలొద్దు. పెయిన్ ఉందా లేదా? నువ్వు ఉంటే ఉందని చెప్పు, లేకపోతే లేదు చెప్పు, నన్ను కన్ఫ్యూజ్ చేయొద్దు, ఓకే? ఉంటే పైకి ఎత్తు, లేకపోతే ఎత్తద్దు, ఓకే? You see the tissue? Every time stop it, make it cool down. కూల్ టిష్యూని కూల్ చేయాలి, ఎప్పుడు కూల్ చేయాలి, అది గుర్తుపెట్టుకోండి. ఆ టిష్యూ చారింగ్ షుడ్ బి రిమూవ్డ్ ఎవ్రీ టైమ్. See, this is the advantage of laser. Did you see any much bleeding here? Anywhere bleeding? And use only the areas which are having pigmentation. Don't go to the other areas. Go gauzy, va? ఇవి రెండు వచ్చాయి, 2 వచ్చాయి. Make the gauze piece so thin that you should adapt the tissues and make the tissue cool. That's a very important thing to whenever you are considering. Oh, yeah. Yeah, you see this? Almost I removed 80% of the tissue without any bleeding. Okay, so now this point a bit here and this point of the interjunction a bit. That's it, nothing much, right? So see the area where there is still some amount of melanin pigmentation, this area and this area. Every time wet gauze is very, very important, because the main disadvantage of diode laser is thermal reaction. If you heat the tissue will get necrosed. Never ever create any necrosis of the tissue, which is not good. So always the movement should be fast enough. Every time clean the tip. That is very, very important. Second. Yeah, you can focus now. See, superficial epithelialization without even 1% bleeding. If you want to clearly observe, I should do lower also. Lower కూడా చేయమంటావా? చేసేమంటావా? నీ ఇష్టం, నాకేం లేదు, నేను చేసేమంటే చేసేస్తాను. కెన్ నేను చేసేమంటావా? ఫైన్, ఓకే, వెళ్ళేయమ్మా. మరి నాకు నువ్వు ఫీజు ఇవ్వాలి అట్లయితే. మింగద్దు, చేదుంటుంది. ఓపెన్ 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 ఓపెన్, నోతిరు నోతిరు. సక్షన్. Hold it. సెక్షన్ రావట్లేదు. ఇది రాలా. ఇప్పుడు వచ్చింది. జస్ట్ నో ఇట్ కేమ్ సార్. చేదుగా అని ఉంటుంది నోరంతా. ఇట్స్ బిట్టర్ రైట్. ఓపెన్. ఓకే, ఐ విల్ రిమూవ్ దిస్. ఇట్ విల్ బి హ్యాపీ ఫర్ యూ. ఎనీవే ఓపెన్. ఓకేనా? పర్లేదా? పెట్టనా తీసేనా? పెట్టమంటావా? ఓకే ఫైన్. బైట్. Lower, she wants to do lower also, sir. Open. కొంచెం పెయిన్ ఉంటుంది. అప్పర్ అంత పెయిన్ ఉండదు, లోయర్ పెయిన్ ఉంటుంది కొద్దిగా. This is a problem of erbium lag laser and diode laser. Diode laser requires compulsory anesthesia. If it is erbium lag laser, no need of anesthesia at all. Happily we can do without anesthesia. Okay na? Parleda? Usesto, 1 second. Okay na? అయిపోయింది. 2 minutes చేసేస్తా. Right. Okay. Cross. Okay. We will do from canine to canine. Okay na? So next. Okay. I'll do from this side. Easy for me. Okay. Pain, huh? Okay. LA spray తీసుకో. LA ఇచ్చానే. Hold it. Okay na? Okay. Okay, ఇక్కడ వరకు ఇచ్చాను. ఓకే, నో ఇష్యూస్. ఓపెన్ యూర్ మౌత్ బిట్. ఎనఫ్. చాలు కొంచెం తెరు. చాలు. పెయినా? గుచ్చుకుంటుందా? ఓకే సారీ. ఓకే. కొంచెం తెరవా, కొంచెం నోరు తెర, చాలు చాలు. We should do always in a sweeping motion, like this. Every time sweep it. This is exclusively for diode laser. Suppose here if you are not able to do it, you can try in non-contact mode also, like this. See, there is a specialty of non-contact mode, you can see. That's it. పెయిన్ ఉందా? ఇక్కడ గుచ్చుకుంటుందా? ఓకే, సారీ. ఒక్క నిమిషం గాస్ తీసుకోండి, వెట్ గాస్. ఓపెన్ అప్ అయిపోయిందేనా? నొప్పేసిందా? ఓపెన్. త్రీ డేస్ ఇట్ విల్ కమ్ బ్యాక్ టు నార్మల్. అంతవరకు కొంచెం స్పైసీ ఫుడ్ తీసుకోవద్దు, మండుతుంది. ఓకేనా? clean all the tissue tags. That is very, very important after you do it. Connection. Goggles, please. A patch in the connection. Open. Right. Done. Hold it. Over. ఓకేనా సో ఒక 3 days తర్వాత 1 week కొంచెం వైట్ స్లఫింగ్ వస్తుంది. డోంట్ ఫర్గెట్ టు సే ద పోస్ట్ ఆపర్ ఇన్స్ట్రక్షన్స్ టు ద పేషెంట్. దెర్ విల్ బి వైట్ స్లఫింగ్ ఆఫ్టర్ 3 to 4 days. డోంట్ వరీ, ఇట్ విల్ కమ్ బ్యాక్ ఆఫ్టర్ 1 week to 10 days టు నార్మల్ పొజిషన్. ఆ వైట్ స్లఫ్ ఏదో నాకేదో అయిపోయింది అనుకోవద్దు. బికాస్ ఆఫ్ ద లేజర్ హీట్ వైట్ స్లఫ్ విల్ బి దేర్, దెన్ ఇట్ విల్ కమ్ బ్యాక్ టు నార్మల్. ఓకే, అయిపోయింది. నువ్వే 1 week తర్వాత నాకు ఫోటో తీసి పంపించు. ఓకేనా? రైట్. యా. Okay, thank you. So that finishes the depigmentation and crown exposure. tips and everything. See, this is a double wavelength laser. There are two options in lasers. This is double and one is triple. Cost wise, this is less. Frankly to say, I don't prefer this. Because the ablation efficiency of double is less when compared to triple. I will say everything there. Because you saw when you are doing hands-on, you can see in non-ablative mode, especially non-contact mode, I did certain areas, especially at the cervical areas, at the papillary area, I did non-contact mode. That option is not there in this. Because that option is there only for 450 nanometer and 470. 450 or 470, both are same, not so much difference. See, there are three options in this. One is 450 or 470, 650 or 810, 980. Nowadays, 980 is almost reduced to 90% not usage of 980. I will show the difference also, why I am not using 980. I will show that also right now, because in the patient I can't explain each and every word, how, why I am not using, why I am not like this, like this. So when you start the procedure, any procedure, first you will get password. Once you open the password, it will come like this. Anything, right now that is the old software which is given in the triple wavelength. This is the new software. Everything is same in the new software except for one more addition of one more wavelength. In this only dual wavelength is there. That is 450 is not there. This is only dual wavelength. So that's the reason cost is less when compared to that. Okay. So there are two options in this, preset and customized. You need not, this is favorites is when you want to do any research, when you want to perform any research or specific wavelengths you want to change and keep it. I want this wavelength. Suppose you want 630 nanometer and you want to do so and so. You can add that and keep it ready. Every time you did not keep all the settings and every time you did not try it. You just save it like that. So once you have preset. Preset is for safe mode. There are two options in this, safe and effective. Safe is nothing will have any harm to the patient. Effective is, just now when I am doing the case, one, there is thickness of the gingiva is very high. In that case, when I am doing the exposure of the implant surface, cover screw exposure or abutment exposure, the tissue thickness is very high. So then I tried with slow movement of the hand, but still it is not getting worked out. Then why I raise it? Because I always said in the lecture, whenever there is less chromophore, you should increase a bit more because laser absorption will be less. The depth of penetration will be more, but absorption also less, so it will go deeper. So it is not able to ablate it, then I raised a bit, just hardly by 0.1 watt. Instead of 0.8, I kept 1. That's it, not more than that. Then it is sufficient to cut the tissue, not more than that. So once you preset like this, in this, first I suggest any beginner to go for preset. You don't try customization of you initially, because if you fail it, unnecessarily you will damage the tissues. That's the only thing. So for aesthetic means depigmentation, whatever I showed right now in the depigmentation of gingival depigmentation in aesthetics. In this, when you open it, the company only gives, see it's in pulsed mode. I didn't even touch, it is in pulsed mode. Because it is in pulsed mode because ablation should be less. Whenever you are doing any ablation procedure, it will be impulsed. If you want to change it to continuous, for example, I should say to expert mode. This is expert mode. This mode is expert mode. The back one is this previous safe mode. In this now I can change. The company says that don't use in continuous mode. It is showing in pulsed mode only. But you are so expert that I want to change it, I want to do in a different style means it will be given, but it is not good. Though it gives, never ever try any ablation mode in continuous. This is a dictum. You will damage the tissues. So keep it, and this is what I said, duty cycle. Actually I didn't explain much in the session, because if you have to have more of this duty cycle, what is pulse period, pulse duration, it will take long time, so I cut short on it. But here I will try to explain a bit. See, here you will get 20%, 33%, 50%, 66% and 80%. Duty cycle means how much time the laser is fired, in simple. Suppose if you are firing only 20%, means only 20 out of 100 or 10 seconds, only 2 seconds laser is fired, 8 seconds laser is not fired. Got it? Same in the candle experiment only. If you have continuous exposure of the laser in continuous mode, see if your candle is like this, you are kept like this. Suppose think the candle is a laser. So continuously for firing means the tissue will be burnt out. There is no time to cool. When you move like this, what happens? You are going away, then you are coming back. So by the time the tissue will get cooled down, so that it will take one more shot of laser. That is the same principle of duty cycle. If you fire continuously the laser, there is no time for the tissue to relax it. Like how so you'll have burning. If you move like this, you will not have that effect. Same principle here. So 20% if you keep. So you can see the output here. The peak power is 2 watts, but the average power is 0.4 watts. Means out of 2 watts, 20% is 0.4 only. So you will be firing only 0.4 watts. You will not fire 2 watts. If you make it 50%, you will get 1 watt. Means 1 watt is fired. Means 50% of the time, you can see here, out of T on, T off, that is pulse period. 50% it is on. Means you will, after 1 watt, the remaining is, there is rest for the tissue. Always when you are cutting any tissue or when you are ablating any tissue, keep the duty cycle as less as possible. Means it should be 20 or 33. But you should, if it is less than 1 watt, you don't have so much power to cut. So you should increase the watt up to 1 watt. Don't see this watt, see this watt. The average power is the one which you should like count and take into consideration, not the peak power. This is what I want to explain there, peak and average power, but I couldn't mention so. So whenever you are doing average power should be always generally 1.5, not more than that. If it is very high, I never use any procedure more than 1.5, except for desensitization, laser desensitivity. That I use a bit high, 2 watts. Because depending on the hypersensitivity reaction, we'll change it a bit. Okay, I don't want to confuse much. So this is what the pulse period. Whenever you are changing this, that is the reason I said, when you want to buy a laser, the average power should be at least 1 watt. Means the peak power should have supporting up to 6 to 7 watts. Then only you will get average power 1 watt. So if you are buying a laser of 3 watts, every time you should use duty cycle 50% to get 1 watt. You understood what I said? So it's like taking a BMW car and driving at 30 km speed. Because safety will be very good. The car has safety features. If you drive at 90, 100, it will go, but you will make an accident. With all features it will be there, but go in a safe mode, in simple way. So buy a high power watt laser, use it low watt, because it should support the average watt. Suppose if you keep 20%, then you should raise the watt up to 5 watts to get 1.1 watt. Suppose your laser itself is 3 watt, then there is no option of keeping this. You should minimally keep it 50% because your average power should be 1 watt. You understood what I said? This is the major advantage. Whenever you are buying a laser, the watt should be very high, 7 watts, 8 watts, but don't use so many watts. Use less watt. This is what I said, short duration with less duty cycle and long pulse period. The duration of one pulse to other pulse should be long. So after one pulse of one shot of laser, you should have certain time, then only second shot, so that the body will cool down. This is what our concept is. Clear? Understood? So when compared to 980 and 650, 650 is infrared zone, mid-infrared zone. Generally we use for PBM, photobiomodulation. This is the tip. This is the tip for PBM, photobiomodulation, which I didn't touch in the class at all, because this takes one more full day for me if I start this PBM. When to use, when not to use, that's the reason I said this, I can't say it right now. But this is the tip which is, that's also called as triple LT, low level laser therapy. So this is the tip. Open the tip and place it and do it. You can do for n number of procedures. After simple extractions also, this PBM is very good, but I can't say this right now because this is the tip. The same thing, this one also. TMJ pains or TMJ dislocations, or not sorry, TMJ clicking sounds. When they are having pain of TMJ, then they remove this and place it like this. This, how many watts, what is the calculation? There is a big history for this. I can't say both these things right now because this is based on the calculation. PBM works on calculation. You can't say for you it's same, for you it's same. No, it is different for person to person, situation to situation. You should have one specific, how to calculate that, you should calculate based upon that. So these two I am not touching right now. These three are the tips which we generally use. This 400 nanometer tip is for ablation. Whatever. That's the reason you see you already kept this pink tip when I am doing both for implant cover screw exposure or for depigmentation. This is the one. This is 300 nanometer tip. Sorry, this is one. Yeah, this 300. Yeah, this is 300 nanometer tip. All are color coded. Blue is 200, green is 300, pink is 400. If you need not see back also, you can see front also. For this procedure, if for this laser, you require initiation of the tip. That's the reason they keep this black dot. Previously, the other lasers, other companies used to have one carbon paper or used to have one plain black paper. Take the paper and try to initiate the tip and then start the work. That initiation will cause a concentration of the laser beam to one particular focus, that particular area, which is not required for 450 nanometers, only required for these two. Even if you change to 980 in that also, you should use stimulation. But the problem is, you saw every time when I am doing, I am just removing the tissue, right? Every time you should activate. Every time take it out, activate and then start. Clean it, once again act. So this will become cumbersome procedure. For 450, you need not activate. It is automatic, self-activating tip. That's the advantage of 450, and you can do in non-contact mode, which are not there in these lasers. So this is exclusively, sorry, not this one. This one is exclusively for endo. Endo root canal disinfection, only 200 is used, and we can use diode. I suggest not to use erbium. Diode is the best for decontamination. Why means that's a big topic for that. So the best laser for decontamination is diode only. That's the reason you can use in photodynamic therapy, you can use LENAP, you can use endo disinfection, everything you can use. But when you want cavity preparation, waste. Erbium mag is the best one, and you can't use this also. For 400 ablation, this is the best tip. Whenever you want to start the procedure, take this, remove this tip. You already kept it. Okay, fine. No need to remove it. Just open this screw and then fix it. And if any charring of the tip is there, see the laser firing. What touch? Foot switch not connected. 1 second. Foot switch connect.
Actually, in the new software, you will get the wireless and
automatic.
wireless and wired. Now we are connected to wired. No, that is the reason it is there in wireless mode.
Wireless mode lo pettunava. Okay, wired mode lo pettu. Wireless mode pettava.
Just go for settings.
Wireless foot switch. Okay.
Now we have to go wireless mode.
Wireless foot switch. Okay.
Both.
But nowadays we are using wireless only, sir.
Here you do this here, two batteries they are keeping.
Connect kala Ramana. Connect to foot switch and ostandi. Pettan already. This is the problem with the old softwares. Actually, the new one, it's completely wireless. This cord will not be there. The new one will have happily just, you can happily place wherever you want, and you can just automatically. And if you not done anything correct, the laser will not be fired and it will show. This like small loose contact or anything like that, it will not fire. It will not fire at all. It will show there. Connect it. But the main advantage, that's the reason nowadays I am not using this at all. I am using always triple wavelength, the new software with advanced one. The same thing except for the triple wavelength 450 nanometer, and you have connection everything which is wireless. That is the best one. Isar will tell that actually adi untadi, adi easiest option. S3 enter then S3. And for your understanding sake, some videos also will be there in this system, prefabricated. Already if you want, you have any doubt when you want to do the procedure of gingivectomy or freenectomy, the prefabricated videos are there, not in the old one, the new one. If you start that, you have a specific option called video. Open that, they will show how to do it. Dr. Sana Farista will come and do it. Will show for you. She is the one because she is having link with Pion lasers. Customize kaadu, preset. Gingivectomy periolo. perio, gingivectomy, surgical, gingivectomy. ఎక్కడో లూజ్ కాంటాక్ట్ ఉంది రమణ, కనెక్ట్ అవ్వట్లేదు. చేసావా? లేదు, కనెక్ట్ అవ్వట్లేదు. ఇక్కడ గ్రీన్ రావాలి కదా, కనెక్ట్ అవ్వట్లే. ఫుట్ స్విచ్ కనెక్ట్ అవ్వట్లేదు. This cordless only we are using. Ippudu connect. Yeah, now it connected. Now it got connected. Remove that. See, now he connected in wireless mode. Okay, right. Yeah. So this is in wireless mode now. Actually, now I am not using any more wire. Completely cordless. We can happily place wherever you want like this, and this green light will be there. It's in wireless mode. Can you have the spectacles? Anyway, 980, no issues. If you are using 450, where is the 450 laser? I will show that difference in that only. Other than that, I will show this only. 1 second. Yeah, come here once. I can show here. See, this is the old software. Old software is old. The software will be like that. You can have a tip, everything. You can see that. Laser ko teeskochesar, sir. Get that laser unit also here. Hold it and get it. Nothing will happen, ma. Come. I will show both at one shot. That will be easy for you to understand. See, the software is new, but the system is old. This one is the new triple wavelength, but the software is this one. Actually, they have the combination of this software is in this. In this software, you can see 400 nanometer tip. Why I want to show this? Because even though you don't know or you forgot, the system only shows that use 400 nanometer tip for gingivectomy. Suppose if you go for endo, yeah, root canal disinfection, right? See the tip? 200 nanometer tip, the blue one which I showed. So, this new software, the screen will be bigger. Not this one, actually still more bigger screen, the blue laser, with this color coding. So by chance if you forget also, the system will show you. This is the old software, but the triple wavelength is there in this. This software should be incorporated in this, which is the new one, which is they came, but they didn't get it for the demo here right now. So in this, you can see 470. Nowadays 450 will be there in that new wavelength, 450. Here 650 is there, 810 is also there. They can get 810. 810 is better when compared to 650. Though he is there, I am saying what are the goods and bad, what are the flaws and disadvantages, because the company is not giving anything for me. I will say whatever I like only. Because they given demo, but I am saying this. 810 is best. You have right now 810 also, not 650, and 980. 3 are there. 810 we use completely for PBM. The tip which I showed, both the tips, the TMJ tip and the PBM tip, this zone, 810 or 650. When compared between 650 and 810, 810 is best. More infrared zone. 470 and 980, 470 is best for ablation. Very good for ablation. 980 I use generally for decontamination, especially in LENAP. When you are using a LENAP procedure, that time I use 980. If you want to know the difference, no. Yeah. See, this is 0.7 watt, right? Okay. You can see here 0.7 watt. Okay. .7 watt, right? Both are 0.7 on. Okay. But this is in continuous mode. This is in pulsar mode. Okay. Both 0.7. This is 980. This is 470. Got it? Right. Get me the goggles. Take the foot switch of both the things. That's foot switch also, please. Those who wants to stay, wear the goggles or go a bit farther. Wear the goggles. I will show it couple of batches, no issues. Where is this foot switch?
Yeah, you see the first I'm using 0.7 watt, right? Done? Wait. It cut out on the tip initiate just can you get me that white paper, that initiating tip one? That white paper 200 nanometer tip ఉంది కదా ఆ టిప్ అది తీసుకురాను. That is the power of 470. ఇది continuous mode. ఇది pulsed mode. Aina see the difference. You understood? This is 0.7 watt continuous mode. Okay, I will raise it. See, 3 watts now. This is 3 watts continuous. Then you can see. Whereas if you keep 0.7, it's not even cutting it. So the 3 watts is equal to this 0.71 watt. Got it? That is the power of 470 nanometer. It will cut. You can also try. The instruments are there with you. You can try it. And you can see here, as the watt is increased, the tissue got shadowed. You can see black line, complete black. Whereas you can see here, it didn't char much. Why? Because too much energy. I am using 3 watts continuous for the ablation. The same thing happens when you are doing on the patient. You try to raise watt and watt because the tissue is not getting ablated, you will get charred out like this. Because ablation power is less for 980. If you are cutting it, I will not use so much power because I will reduce the power. You understood the difference? You feel whenever you are doing the procedure, laser procedure, if the tissue is not getting ablated, what you think, sir, it's not cutting, so I will raise the power, I will raise the power. When you are raising the power, you are damaging the tissue like because you are giving too much of energy to it. Otherwise, it is not getting ablated. Whereas if it is 0.7 watt, for minor power also it will ablate very fast. So you will not use high watt. Automatically use low watt. When you are using low watt, tissue will not be damaged because you are not giving much energy. Then you can ask, sir, why it is happening? I said, whatever the laser is fired, continuously, completely taken by the body, then it will work very fast. Some part is absorbed, some part is scattered, some part is reflected, some part is dissipated, means you will not have that power. The blue laser has that capacity to have complete absorption of the laser and have effective ablation mode. Whereas 980 is not having that. That is the reason nowadays we are shifting towards blue laser. Understood? Even Pion has come with blue laser, the other company is going to come. Even the Sirona company, they also wants to come to that blue laser effect, but still they are doing. Now only 2 lasers are having this blue laser effect. One is Photon, one is Pion. But Photon is having slight disadvantages in the software, not with the system, software. After 2 years, it's getting hanged out, stuck out, something like that. So Pion is, and compared to other, it's better. You got in the cost. So the advantage of this, just now you saw, right? So whenever you are doing, and second thing, if you want to do in non-contact mode, back. So procedures.
So if you want aesthetics, so if you want depigmentation, so 1.5 watt and 1 watt is the power. So I kept 980, 470 nanometer ready, right? Whenever you are using 470, this is compulsory. 980 I may or may not, but 470 I never play, because very high ablative laser, it will damage your eyes like anything. Either you watch in cell phone or you watch with the lens. Don't watch straight. Okay. You can see here. You can see the distance, right? See? You can see the distance, right? It is not touching the tomato. See the power of it. But you didn't char much in the patient, but it is charring here. Why? Because the tomato has thin layer, it will get charred out faster. But and for you to show, I am just holding like this. I am not moving the tip. Whereas in patient you saw on the other girl, I am keep on sweeping motion. I never had more than 1 second on a particular area. I just ran like this, and I kept only in 470 nanometer. I never tried 980 because she's a student. I don't want to experiment on her. I know which is good. So automatically I tried on 470, exactly 1.9 watt I kept. You can see my hand movement so fast when I am doing it, because, and that's the reason there is no charring on her. You can see on both the lips up, I think those who are there inside beside me, not even one char tissue is present. Why? Because that is the specialty of 470 nanometers. And I can go faster and the work will be easier. The same thing if I want to do in 980, I am not using it at all. It's like doing a manual scaling after doing ultrasonic scaling. I don't like a manual scaling after doing ultrasonic. 110% anybody can agree with that. Because long time, too much energy, unnecessary wastage of time. So why you will do it? Easier technique. Ultrasonic is faster. Then why you prefer that? Same thing. 470 also in lasers. After the advent of 470, I am not using 988 at all. I reduced it. Either I use 810 for photobiomodulation or 470 for ablation. Very rare instances, especially when I am doing a LANAP or any other decontamination, then I use 980. Decontamination, 980 will be good, because you need not require so much of energy to cut the tissues, right? 980 is sufficient to destroy the bacteria. So that is the reason 980 is present. But 90% when you are doing gingiviectomy, frenectomy, operculectomy, crown lengthening, tongue tie, or depigmentation, anything, even extraction, coagulation, everything I use 470. 470 keep 0.8 to 1 watt, just fire on the coagulation system, just dip through the surrounding area, finished. It's like PRF only. So that's the main advantage of 470 nanometers. And duty cycle, if you want to learn, you should come to the workshop, because I can't explain so much about PBM and duty cycle because it takes a lot of time for me. So these are the things I just want to show. The main advantage, and you need not have activation of this tip. Whereas this tip, I use the paper or the small black one to activate. This I never use activation. And without activation only, it took certain time. If you want to activate every time means, it will be still more time taking and time consuming. That's the main disadvantage of 980. I'm not saying disadvantage. Previously I used to do 980 only. That's what I said. Once I got the better one, I'm not using the old one. Simple. And I suggest you to practice this every time, because when you are holding the laser, most of the time don't hold like this. Hold like this. And the sweeping motion, when you are seeing my hand movement also, it will be like this. This tip will change to angle like this or like this. When I am doing cover screw exposure, it was like this. But when I am doing depigmentation, it was like this. Even depigmentation can be done with the other tip also, with the non-contact mode defocus tip also. This will cause focus of the tip. In PBM, you will learn all these focused and defocused modes, what is the advantage of defocused mode, when you should use this. But for you, 400 nanometer tip, if you want to use in the focused mode, place like this, take the proper support, do in the sweeping motion. And even if you want to do crown lengthening, is there any Gocha? Crown lengthening we do in two options. one single line, you pass the line like this and remove with the curette. This is the easiest one. But the problem with that single step crown lengthening is, if you cut excess, tissue is gone. There is no more tissue to regrow. The problem, initially I suggest to use the other mode, second mode, like sweeping motion mode. Once you get expertise, use the straight mode, that is perpendicular. And second thing, if you are using the straight mode, you should have always control on your fingertip, on your tip. If you use just extra also, you are exposed the bone. I showed one case exactly 2 mm required, right? In that case, exact measurements are required. If you cut excess, the problem with the laser is it will be charred out. I still remember one case, I never forget, because when I am doing my post-gradation, I still remember this case. One patient came. As the initial heroic adventures I did with laser, so what happened, we did same thing like how sir, they referred from Prosto, saying that we want a crown lengthening case on 3/7. Still remember the case in my eyes, I can still feel that 3/7 lingual side, they said we require 2 mm. How much? 2 mm, right? So instead of, at that time I don't know much about lasers. There is a laser machine in the department, okay, get it, see the crown lengthening, okay, done everything, 980 is there, okay, fine. I should first measure the biological width. First I should measure the probing depth first, see the probing depth. This is very important for crown lengthening, because why I suggest is, there is a different, aesthetic concept is different, but for your understanding what happened in that case, what I did my mistake, I still remember. You measure the biological width first, that is 3 mm. From the marginal gingiva, you should have at least sulcus depth 1 mm, epithelium plus connective tissue 2 mm. That is junctional epithelium plus connective tissue. This is the basic biological width. So 2 mm should be there. That is from the crest of the bone, if you measure 2 mm plus at least 1 mm sulcus depth. So total 3 mm should be there, minimum sulcus depth. So if I cut 2 mm, then only 1 mm will be left. So I am violating the biological width. So if that is the case, there are many options for that. Depending on the width of attached gingiva, whether you should do apical position flap or whether, what is the best position, there is classification for that I don't want to go much deeper. In simple case, suppose if you are exposing the bone, first you should open the flap, do the bone trim, first you should cut the tissue, then do the bone trimming, then open it surgically and then suture it. This is what we generally do for surgical crown lengthening when you want to perform it. I didn't see the amount of sulcus depth. They said 2 mm, okay, see the 2 mm. I just removed the 2 mm. I didn't feel the 980 because it's very thick enough, so I tried, okay, it's not cutting, so I'll go still more deeper. I removed 3 mm. Bone exposed. I thought, okay, what to do, then we will try something like that. I tried to remove it, but I didn't keep the proper biological width. Patient went off. At that time in anesthesia, no problem. After 2 days, patient started jumping and coming. Sir, pain, 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 pain. What happened, initially when I kept it 980, I didn't realize the amount of heat that I'm generating. Like how I did, right? Increase it the watt, 1 watt, 2 watt, 3 watt. What happened? Tissue got charred out. That time I don't know, because on the lingual side of 3/7, who is going to say all saliva is coming out, so I didn't see properly. Fine, okay, leave it. Patient after anesthesia came jumping saying that 1.5 mm bone exposed. Because of the charring of the tissue, that black tissue will be gone out, right? Later, then you can see the exact margin. Patient is jumping because bone exposed. What should I do now? 3/7 lingual side, 1.5 mm bone exposed. And the problem with the laser is, if it is scalpel, at least the tissue will grow faster. With the laser means it will be burning out the tissue only, and there is no tissue, and the gingival phenotype is very thin. I never forget how much scoldings I received for that case in my lifetime from my HOD. Sir simply didn't say anything at that time. He just came and saw the case, he come back to me. He literally blasted me like anything, because what you did to the patient, now what should I do it? Because tissue is gone, completely necrosed out, 3/7 lingual, tongue is coming on this zone, salivation too much, so nothing is visible. It took 4.5 hours to repair that whole case for us, because open the flap completely, do the trimming, ask the prosthodontist to come, see how much of still crown is exposed out and it was sufficient or not. He came, HOD sir came and still opened, because it is very thin and fragile. If you tear the gingiva, Still condition will be miserable. So he came, he opened it very slowly, did the bone contouring with the burr, completely 1.5 mm plus 1 mm means 2.5 mm of the bone lost because of single mistake done without knowing proper settings of the laser. Then cover it, do the flap, do the suturing at 3/7 lingual, then send the patient, and patient is slapping like anything. What procedure are you doing for a single crown lengthening, and prosthodontist is asking how much days it will take to recover back. It will take time to heal, right? So almost 2 weeks time to heal back. Then patient came, now the gingival overgrowth happened. So once again severed from prostho, this time I didn't attempt, sir only did the case, did with scalpel, then fixed the crown after 1 month. Patient was literally blasting every staff like anything because of single mistake which I did in second year PG without knowing the laser setting, increase the power to 3 watts. Why I am saying this case is that taught me a lesson: never do any heroic attempts when you want to do it, because raise it to 3 watts, done the damage, so I can't. So then at that time I got interest, no, I should learn the laser to the maximum extent and then I should do it. So that made me interest on the laser to learn to the maximum extent so that I can do without any mistake. That's what I say to every student. So when you are doing any procedure, don't try any heroic attempts when you are doing it. If you know it, do it. Or go to the safe mode given by the manual or instructor. If you try anything new, you should know it, why you are trying it, and then do it. Without knowing proper knowledge on the procedure, if you try with the laser, you are burning with the tissue, especially 450 nanometer. 980 you can try whatever you want, it will not have much damage. But if you are trying with 450 ablation mode, be very careful. That's what I want. This is the only caution which I give to the students when you are doing with laser. 450 is like double-edged sword. If you do properly, perfect. If you do reverse, it will be miserable. Okay? Start. We can have the demo. Then once you start your hands-on, any doubts you can ask me. Okay? Start. Any doubts right now? You asked for crown lengthening, right? Yeah. Get me the blouse and this one. So as this is a jaw and it is dead and it is white, so there is no chromophore. So I raise the watt. So remember one thing, a patient with dark skin, you want to do depigmentation on the patient. A patient with fair skin, you want to do depigmentation, gingivitis. For which patient you should use more watt? Which patient? 2 people are there. Okay, you want to do PBM, photobiomodulation. Okay, remember, okay, you can say crown lengthening only, not this one. Okay, see crown lengthening only. One patient is fair, one patient is dark. You want to do crown lengthening. Which patient? And the phenotype is same. Both have medium phenotype or not very thin phenotype or thick phenotype, medium phenotype. Both are same. Only one thing is color. Which one you use more watts? Why? Why? It is reverse. Fair skin. Why? Whenever chromophore is present more, you will take more. If my attraction is more laser will be taken by that.
Remember only one thing, dark likes always dark. Diode likes dark. So, when the patient's skin is dark, full laser will be taken by the skin. So, whole laser means more effect will be there. You reduce the what? You will get burning sensation. Patient is fair. Diode doesn't like color, without color. Diode wants color. So, that's the reason I said to squeeze it. When you are squeezing it means the penetration is more because its attraction is not there. So, you want more laser. Simple, remember this concept. When the attraction is more, reduce the what? When the attraction is less, increase the what? Attraction means color. When the pigmentation is more, reduce the what? Because the whole laser, whatever 1 watt, will be taken by the body. If the color is less, I mean to say patient is fair skinned, increase the what? Because color doesn't like by the laser. You want more of pigmentation tissue. So penetration is more. Power is less. So maximum amount it will not like, it will not take that laser. So you should increase the what? Understood what I said? For PBM, that's why I am saying is photobiomodulation will be done on the surface. If the patient is dark skin, use same means she will feel burning sensation. Same what? Because skin will take more. Understood what I said? Remember this point. Diode always likes dark. So reduce the what? Got it? Yeah. And the main one more problem with diode is diode likes more on photothermal effect, whereas erbium VAC works on more of photochemical effect and photoacoustic effect, photomechanical effect, not on photothermal. That's the reason erbium VAC will not be hot. This is called hot tip effect. If you feel the tip, it will be very hot. It's called hot tip effect because this works on photothermal effect. That's the reason I should give anesthesia for the depigmentation. For erbium VAC not required because it will not work on photothermal effect. Whenever the heat is there, you will feel the pain. But if the heat is not there, you will not feel the pain itself. And water will be there for the erbium VAC. It will cool down the tissue. And the depth of penetration is less. Only epithelium will be scraped out. So you will not require anesthesia at all. If I have erbium VAC, you can feel that. That's the reason if I compare erbium and diode, I like erbium more. Erbium will be very good. Sorry. Yeah. This is not liked by diode. It is full fair. It should be dark. At least some red color should be there. This is full fair. Pink, white color is there. So diode don't like this. Not even blood, not even a color. Both are not there. So diode doesn't like it at all. So you should use more power to have the same effect. Why I am saying this? Because company manufacturer will not say fair, dark, all these things. You should know when to use which power or when to reduce and when to increase it. So for your sake, just I am showing it. Those who are nearby wear the goggles. Those who are distant see with the cell, not straight. Where is this? This one only, right? No, that is for that, sir. This one only. See, when you are doing crown lengthening, right, okay. So there are two methods. One is you measure the bleeding points and then fire the laser like this. One shot. You measure the bleeding points exactly, how much amount of laser is required. You place the bleeding points and exactly fire the laser like this and cut the tissue. One option. Or you place the laser like this and remove layer by layer like this. Like this, layer by layer. But the bleeding points are compulsory. See, when you mark the bleeding point, suppose this doesn't have proper crown lengthening option for me. Okay. See, suppose if you mark the bleeding points like this with the with the probe, how much amount you want, mark with the bleeding points here, then join the bleeding points with the laser like this.
In this advantage, one shot you can remove the tissue. But the problem is, if you change the angle or if you go in the different direction, tissue will be burnt out. Second option is, after marking the bleeding points, you go layer by layer like this. Like this. This happens, you remove the superficial epithelium only. If you remove, by mistake happens also, you can leave that and you can adjust it, because the tissue will once again grow back. If you are doing layer by layer. Understood? So the two options, initially I suggest you to do like this, layer by layer like this. Understood? This is the concept. Even depigmentation, I want to show here, nothing is there. No pigmentation at all. What to do now? So if any pigment, that's the reason, sir, arrange a live demonstration. At least you can see on the patient straight away. But for you, if you want to practice, some amount of pigmentation should be there on the goat jaw. But this goat is very clean, I think. White is there. I can't do anything. So you practice, start from this. First practice the incision lines first. How much force you should use without charring. As least charring, as much you should get. The hand movement should be in such a way. The main purpose of this workshop is you should feel the movement of the laser. When I am doing it, it will be very easy for you to see how fast I am moving. Now I will see how you will do. If you hold the laser and ask you to move the hand, then you will understand the pain, how you should move, because you should synchronize with the movement of the tissue. You saw in both the cases no charring, right? It is pink and fair in color. When I am doing a cover screw, a bit of charring at the top area. I know it, a bit of charring. That happened because the tissue is very thick. I should cut couple of times. Without charring, you should do removal of the epithelium. So now you see how much time you pass the lines. You see with 470 and you see with 980, which will have more charring and which will have less charring. Okay, start it. I will just let you know. Group divide into 3-4 people. There are 4 lasers, I think. You can start practicing. I will come to each group and I will see how you are practicing the laser. You can see here 2 lasers are there. You can take into 2 groups. Here also 2 lasers are there. You take this laser. Start. Now you should practice. Now I will see how you do. Hand wash. Thank you. Most sound. Is it okay? Okay, right, yeah. Whenever you are cutting the tip, use only laser to cut. Don't use glass fiber to cut. Because some people are creating holes in the tomatoes. Don't do that. You should cut the tomato with the laser, not with the fiber tip. These three groups are using 450 nanometer, so they know the defect. I suggest once they finish, you go to the 450 nanometer and experience, because you have 980, because that will not cut so fast. I think now you can understand. She is cutting, keep on cutting, it's not cutting. Try. That's the specialty of 980, it will not cut so easily. The problem with this one is that's the same thing. When I tried initially, if you want to use really 980, your hand movement should be very slow and synchronized. See, you kept 1.7 watt, right? Average power, right? Now if you want to move the hand, the main mistake what you do is hold like this first. Like this. If anybody has goggles, 1 second, maybe goggles, just give the goggles to me. You press the button. 1 second. Where is the tip? Fire it. Fire it, press it. You're pressing it? Okay, fine. Okay, stop it. Now fire it. Fire it. Stop it. See, this is the cut required. Got it? See, uniform without sharing. Just like a line. This movement you should understand. That hand skill of movement of the laser is required. You should practice n number of cases. You will not get in one day. Keep doing the movement of the laser. When you have laser instrument in your department, you keep doing that. Then you will get this. Practice like that. You should not have any, even for me, you can see initial part I charred a bit. Initially, because I didn't move a bit faster. That is the main problem with 1.7 watt, high watt. Okay? Start practicing like that. See that, start drawing line base just beside that. So how are you practicing? Stopped it? Yeah. Without goggles I can't come near because you are in 450. Where is the one which you did it? Even I couldn't see where you did it. Huh? Fantastic. Contact mode or non-contact mode, with some line should be there. She didn't even fire the line. Aya, where is this? Get me the goggle 1 second. I didn't understand how you fired without having any damage. Fire the laser. Fire the laser. Fire the laser. Stop it. See? I did intentionally slow. You see the line? It got shadowed. I didn't understand where you did, nothing is there. See, this sharing means your 450 watt, I am doing very slow. So I should increase the point. Suppose same thing I keep in 980. Sorry. Same watt, right? Same power. 1 second. Fire the laser. Fire. Fire. Stop. See the difference in the cutting. This is what I want to observe. Same 0.7, same duty cycle, just change the wavelength. This is 450. So ablation will be very high. Your hand should be very fast. Vamsi. Vamsi cheppu. ఇప్పుడు జరుగుతుంది కింద ఆ రేపా
Yeah. Good, but the problem is you fired the laser, but the laser beam firing was not continuous. You stopped in the mid. Bits. You should be in a uniform straight line. Like. See, straight line. You should not form intermittent dots. When you are firing intermittently, what happens is the tissue will get charred out a bit in the center. Means your movement is not straight and synchronous way. You are stopping a bit like this. That happens because of what happens. And whenever you are doing any laser, suppose if you are doing gingivectomy, and you want to fire the tissue, when you are seeing my procedure, when I am doing cover screw removal or when I am doing depigmentation, I pass it like this. I never did back. If anybody observe when I am doing the case in the demo, anybody observe that I did movement in the back side? Suppose I fired the laser like this, I never do it back like this. I will go to the once again starting point and do like this. Not reverse direction, because never ever do reverse way, because suppose if I have done the firing like this, don't do like this, because the tip will be heated at the last and this tissue will be having more thermal damage. If you do reverse it, this tissue will be heated up to the maximum extent and it will cause charring. You should start from the first only. And every time I will be cleaning the tip compulsorily, and the tissue should not be there on the laser tip. If the laser tip is having tissue, the laser will not be fired properly. Improper firing will cause two things: scattering of the laser beam, which will cause unnecessary damage to adjacent tissues. You will raise the heat and temperature, thermal damage will be there, and on top of it, ablation will not be proper. All three worst things will happen if you are not cleaning the tip. Every time clean the tip, cool the area with the gauze. If you are not cooling the area with the gauze, tissue will get heated out, especially 450 will has high amount of heat energy. You should cool the tissue. Remember these 3 points. If you don't do also, no problem, but if you are doing, cooling of the tissue should be there. Every time you see, I am using the wet gauze to clean, placing the gauze, removing, and once again doing it. This is very important to prevent charring. Otherwise, healing will be delayed and you will get patch like appearance, which will not be good. Once you finish, I request you to come here, and these people will come there because they don't have 450 nanometer experience, so they have only dual wavelength. And the laser which they are using is via media laser M3, which has triple wavelength, but when compared to S3, it is less cost. That is around 3.8, I think, not 4.5. You will get around, this is the latest one, 3.6 or 3.7. They want to have triple wavelength, but in a low cost when compared to S3. This is kottadi. Ante koncham via media, this one. Because the screen is short. They made this because this is generally that is 4.5 LED screen. This one the screen is small and the features are less. But the triple wavelength, you will get 3 wavelengths, 450, 650, sorry, 450, 650 and 980. But nowadays they are using, instead of 650, they are using 810. And that one you can see 470 is there in that. This is 450, right? That one is 470, that's the older one. New one has 450, 810, 980. And within 3-4 months they are coming with quadruple wavelength, 4th wavelength also. But that is not for ablation, that is for diagnosis. Diagnosis of the, as I said, carious tooth. And I didn't say, actually laser is very, especially the blue laser is good for gingival troughing, which is mostly used in prosto. Gingival troughing, when you use a retraction cord, you will unnecessarily damage the tissue. How far you are a super periodontist or a super prostodontist, when you place it, unnecessarily you damage and some amount of irritation will be there. And the tissue regrowth is faster. If you do the troughing, you can happily place it very nicely. Gingival troughing we call it as. It's there, you can see there, in the prosto you can see gingival troughing, one option will be there. I didn't touch of prosto, endo, ortho, I touched only perio. The laser is used in skin therapy also. Anybody can say? Yes, very good. Scar removal, perfect. Yes. Anything else? Most of the film actors are doing now one of the laser therapy instead of, yes, whitening. And second thing is skin tightening. Your film actor Nagarjuna will be always fair and glossy because of this therapies only, not because of age. How he is controlling age is, that's called as, we will create microthermal zones. When you pass the laser, you create microthermal zones in the particular areas of the skin. What happens? Everybody knows that when you damage the skin or any part, you will get fibrosis, right? You will have a fibrosis. So when you damage this, what happens? The skin intentionally with certain particular depth, microthermal zones, the skin tissue will be activated and you will get fibrosis. You can see anytime when the scar is happening, the skin will be tight. You can see like retraction, even the lines also you can see. So what happens in the wrinkled skin becomes firm, thick and tight. But this is not genetical. You are intentionally making it. So every 6 months or 1 year, like how you do depigmentation, you should be keep on repeating the procedure. That's the problem. This is now we are trying in dentistry also, especially for root coverage procedure, but still not yet successful. If that is successful, 50% of the carranza will be reduced. All root coverage procedures will be gone at one shot. But not successful yet, still they are doing in rabbits. Any doubts you can ask, no issues. Yes. Yeah, how can you standardize the wavelength? Means? Yeah. See, for any ablation procedure you mean to say, that means a gingivectomy, frenectomy, operectomy, crown lengthening, these procedures, any ablation, all these procedures, tongue tie, whenever you are using ablation, I use 450 nanometer. That is blue laser, which is having best ablation. And what is the watt? Watt depends upon three things. First one, the thickness of the tissue. Company gives 0.7 or 1 watt, okay, 0.9 watt. That's why I said, see, company gives 0.9 watt, okay, that is safe mode. The patient, like how sir showed morning case, it is very thick with more amount of collagen fibers. I say company is saying like that means it will not cut. You raise the watt a bit or reduce the hand speed. Second thing, if the patient is darker skin, that's what I said, reduce the watt a bit. If it is thin phenotype, still reduce the watt. Don't follow the same company protocol, because company protocol will see the standards levels, not the thick phenotype or thin phenotype. You see the phenotype of the gingiva. They ask her one question, if the patient is healthy crown lengthening, if you want to do a crown lengthening in a healthy patient, same crown lengthening in an inflamed tissue, like where there is gingivitis, which will require more watt? I am asking the question. If two patients came from the prostho department, asked crown lengthening, one has healthy gingiva, absolute normal, no problem. One has gingivitis. Which will you use high watt? Perfectly correct, yes. Healthy tissue requires high watt because gingivitis patient has more of inflammation, you have more blood. Whenever there is chromophore, reduce the watt. Simple. So to cut the normal tissue, you require more watt. Whenever there is chromophore, reduce the watt, because already blood is there. If you cut, whatever the laser you are firing will be completely taken by the body. So it will cut deeper then. If you use more watt, you will get more bleeding and more charring also. Because it's like having a full bleeding area. If you puncture it, what happens? You will get more bleeding and improper cutting of the laser, because the laser will be absorbed by the tissues more. Understood? So that's what I said, whenever you are doing a procedure, company gives one protocol, 0.9 watts, 0.8 watts. You see the phenotype of the patient, thick phenotype or thin phenotype, more melanin pigmentation or less melanin pigmentation. Based on that, you adjust the watt a bit. More fibrous tissue or less fibrous tissue. That's why I said this is called safe mode. What I am doing is effective mode. Don't adjust too much. You can see the difference. See, just now when I did, you never saw charring. Why?
I adjusted, okay, this is not sufficient. I reduced my hand speed, still not sufficient. Increased just 0.2 watts. When you are using 450, 0.2 itself is very high cutting ablation effect will be there. You need not use 0.5, 0.7 watts. Of all the procedures which I do in ablation, 1.5 is the max, not more than that. 1 itself is sufficient. For 1, and the main problem is when you are increasing the watt, your hand movement should be very fast. If you use too fast, you don't see what is happening there. Already if you are wearing goggles, you can't see what is happening there. Now you understood the difficulty, right? When you are wearing the goggles, you are not seeing what is happening there. Then you can understand when I am doing the depigmentation, how can I feel it? So that comes with experience with the hand movement. Understood?
How much will be the percentage of shrinkage?
Yeah, very good, sir. The person, nobody asks, see, sir, staff is asking more questions than students. This is what happening, fine. The percentage of shrinkage with laser is very less when compared to scalpel. Why? Very less. Because you are charring or burning the tissue. So the shrinkage will be very less because inflammatory response is less. See, if you have a burned skin, you will get a new layer, but you will not have a shrinkage of the skin. Whereas if you cut with scalpel, inflammatory response will be activated by the body, automatically shrinkage will be there. So when compared with scalpel, that's the reason regrowth is more with scalpel, because body has a reparative mechanism to fight. Wherever blood is there, when you cut, what happens? Blood will come. Blood has rich growth factors. That's the reason we are using as PRF. So whenever there is more growth factors, tissue will grow more. Got it? When there is, with laser, you are simply burning the tissue. That is also disadvantage also and advantage also. That's the reason you can appreciate the line clearly. Because you are exactly removing and burning the tissue. There is no much shrinkage. But if you do improperly, tissue will not be there. Understood? So you should be very cautious enough when you are cutting it. Cut exactly the margins. If you cut excess and say, now I want tissue, means gone only. That's the problem. Even when I am doing the depigmentation also, I am seeing the depth of penetration of laser. If I do too much and cause too much heat to the bone, you will get necrosis of the bone. Because this is having high absorption capacity, and bone has, when compared to tissue, bone is having more sensitive to heat. Tissue can tolerate up to 60 degrees because of coagulation. Bone maximum 40 degrees, if you raise it will cause necrosis. So never ever raise the heat of the surface. That's the reason every time I keep gauze. Surface heat should not be dissipated to the underlying bone. If the patient is a thin phenotype patient, you will raise the heat means you will cause necrosis. That's the reason I am not pointing the tip like this when I am doing depigmentation. I am pointing the tip like this. Because heat will be dissipated like this. If I point like this, what happens? The whole area will be concentrated down and will touch the bone. If it's a thin phenotype patient, what happens? And your movement is less means you will heat the bone. There is a lot of mechanism for every movement of the laser, every explanation is there. That's the reason I am not concentrating much. I am just saying to do like this. Even Lena pulse is a different procedure. Where I said laser assisted new attachment protocol, the movement is different. You can't simply place like this. It's different. The movement will be more towards the tissue, not towards the tooth. Perfect. If you are doing endo disinfection, by chance you raise the what happens? Diode doesn't have much effect on the dentin. Much effect. It has heat, thermal damage. It will cause coagulation of the fibers, coagulation of the dental tubules. That's done. Other than that, much. Yes, apical tissue damage is the major problem, because apical tissue is soft tissue. If you pass the laser too much time without giving the periapical, you will create unnecessary nonsense or problem. That's the reason 1 mm safety distance is measured. I said working length less than that 1 mm. So that below the working length also still 1 mm of the dentinal wall will be there. So minimum 2 mm from the periapical tissue is there. That's why the safety distance is allowed. That's the main advantage of laser, but don't go till the base. You can shift if possible, because these people are not experiencing the 470 nanometer.
వస్తున్నా హ్యాండ్ వాష్ చేసుకో